Morning, everyone. I'd like to call this meeting of the Public Accounts Committee to order. Before we do so, I'd like to open the meeting with a prayer. So I ask if you would pray with me at this time. Heavenly Father, you have made us in your own image. And Father, we live in this life to serve you. We are grateful for the opportunity that we have this morning to attend and to participate in this Public Accounts Committee meeting and inquiry, where we seek to do the work of the Parliament and of the government as part of the overall good governance that is required of us all. And Father, I pray that as we go through this hearing this morning, that everything we say and everything we do will be done decently and in order. And as always, Father, we give you the praise through your only begotten Son, Jesus' name. Amen. Good morning, everyone, once again. We are going to get underway with the continuation of our inquiry of the Auditor General's report on the financial reporting of the Cayman Islands Government, general report on the results of the 2024 financial statement audits. So this morning, we will have as our first witnesses Ms. Lizette Yearwood, the Chief Executive Officer of the Health Services Authority, and she is accompanied by Ms. Sheila Thomas, the Chief Financial Officer of the Health Services Authority. At this time, we'll ask that they be brought into the chamber. Chris, do they have it? Okay. Good morning to you, Ms. Yearwood and Ms. Thomas. Thank you both for being here this morning. We are going to move forward now with questioning you on the content of this report as it relates to the HSA. Before we do that, though, yesterday we started a procedure of actually asking my word. Witnesses is the word I'm looking for, to swear an oath before we undertake and take the testimony from you. So I think you have we'll have the piece of paper with the two choices you have. One would be to swear the oath, or secondly, to affirm it. So I'd ask you, Ms. Lizette, if you would take your oath now, give your oath now, and the choice is yours as to which you use.
Thank you, sir. I swear by Almighty God that the evidence I shall give to this honorable Parliament shall be the truth, the whole truth, and nothing but the truth.
Ms. Thomas.
Thank you, sir. I swear by Almighty God that the evidence I shall give to this honorable Parliament shall be the truth, the whole truth, and nothing but the truth.
Thank you. We are going to get started with the questioning this morning. And leading off the questioning will be Mr. Kenneth Bryan. So, Mr. Bryan, I'll turn things over to you and ask you to lead off with questioning of our witnesses.
Thank you, Mr. Chairman. Good morning, everyone. We are here today to review the Auditor General's 2024 report, a vital process in maintaining the transparency and financial health of our country. Our objective here today is not to cast blame on anyone or any entity, but to understand the significant concerns that have been raised by the Auditor General. To our witnesses this morning, we appreciate your presence and we recognize the challenges you face to run the organization at Health Services Authority. However, it is our duty to ensure that the public funds are managed with the highest level of integrity to protect the national financing. As we are all aware, you manage well over $200 million of the people's money. Let us proceed with the goal of strengthening our public institutions for the benefit of everyone who call the Cayman Islands home. With that being said, good morning, Ms. Yearwood, and good morning, Ms. Thomas. And morning, colleagues. I'm going to open with a basic summary, so to speak, of what was in the report. I'm certain that both witnesses have seen it and the suggestions made by the Auditor General and their team. But just to refresh your memory and my line of questioning, I'll give you some summary facts. We note that the HSA has received unqualified, for those who are listening who may not know the accounting terms, a clean audit opinion for 2024. However, despite the clean opinion, the Health Services Authority recorded an operating deficit of $12.4 million in 2024. Sadly, it's the largest of all the statutory authorities across the Cayman Islands and government-owned companies. This is particularly concerning given that the HSA received $25.6 million in government funding and earned $179 million from other sources. And interestingly, most of those other sources are from government as well. This financial performance raises current concerns about the financial management of the authority, funding adequacy, and the operational efficiency at HSA. The HSA budgeted a surplus for $662,000, but unfortunately reported an operating deficit of $12.4 million, resulting in a variance of $13.1 million variance from the budget. Now, to just start the questioning with that background, let's just talk about what are the primary reasons we are in this situation and how, because it unfortunately has occurred before. Can you just give us a summary of how we got to that $12.4 million deficit?
Good morning. Through you, Mr. Speaker, I'd like to thank the Public Accounts Committee and yourself for the opportunity to be here today to discuss some of the challenges that we face at the HSA as the national healthcare provider. I also like to thank the Auditor General's office and his team for the collaboration that we have on an annual basis so that they can help us grow from strength to strength. So I'd just like to start off by kind of putting things in context, because HSA as a national healthcare provider provides care accordance with the mandate laid down in the Health Services Authority Act, and that's aligned with WHO standards for national health systems. So we use that as a framework each year when we sit down to look at our strategic planning to determine, what services we provide, how we provide them, and how we meet the growing demand of the community. And our mandate has always been to ensure safe, appropriate care that's accessible for all persons in the Cayman Islands. And I think that that's one of the things that provides a challenge to us, is that we provide care to all residents regardless of their ability to pay when they receive services. So, the demands that are placed on us on an ongoing basis are extensive. However, we continue to collaborate with private providers to ensure the best outcomes for our patients. And we prioritize timely, safe, accessible care. And with the growing population, you will see that some of the services have been expanded to ensure that the care is accessible where the individuals need and the type of services that is needed. One of the other things in our mandate is to ensure resilience. As the public healthcare provider, as a national healthcare provider, we have to maintain an essential capacity to ensure that we can respond to emergencies, we can respond to surges such as we saw during the COVID pandemic. So that too is one of our mandates that is used at the backdrop of all of this. So just to give you a little background about the depth of collaboration, from a data perspective, we referred over 28,000 local referrals last year and over 1,500 overseas. So we recognize that HSA cannot provide all of the services despite any expansion that we have done. And we, from the mandate, from the minister, we want to make sure that we collaborate. So the resilience is not just at the HSA level, but the resilience is a national resilience. And again, I'm drawing from the experience during the pandemic when there was no transport available to our people. We here in the Cayman Islands, with HSA and the private healthcare providers, took care of all of the emergency needs during that period during the pandemic, including the neonatal births that were had at the time. So again, we do have a very detailed referral process that from time to time we go back and we review with our physicians to ensure that we are providing timely access. One of the things that we've done recently as well to focus on the access is that our board and minister has been working with us to look at the waiting time for outpatient referrals, and a directive was given that if those referrals, the non-emergency referrals, was to be anything in excess of 90 days, we should collaborate with the private providers to refer to them in order for patients to get timely access to care. The other thing is that we do in the emergency room, because we are at the place now where our hospital is beyond capacity, and therefore patients coming into the emergency room sometimes have to wait for beds to be admitted to. So if there's a case where individuals are going to be made to wait in excess in the emergency room, we also collaborate with the local providers to transfer patients to them in order to ensure, the timely access to care. However, I must emphasize that any sort of transfers or referrals is limited to the availability of insurance for those individuals. Because if individuals don't have insurance, they will remain with the HSA. So with that in the backdrop, we recognize that the deficit was the $12.4 million. And yes, we do get payments from Cabinet in order to provide certain services. However, I think it's a known fact that the outputs that we receive is not sufficient for the care that we provide. So we have two different types of outputs. And one is episodic. So as patients are seen, those funds are released to us. But there's also a type of output funding that is called program output. So those are supplementing certain programs that we have. But even with the supplementary outputs with the funding, it's not sufficient to carry the full cost of those services. So just to put that in context, we had outputs for a total of $25.6 million last year, but the actual cost for those outputs was $59.7 million. So almost double what we were actually paid for that. Again, going back to the access of care, we care for residents across the board. Many of them are uninsured or underinsured, those that have the SHIC coverage. We work with the individuals, we take care of them, and if they don't have the funds to pay out of pocket, we engage with a promissory note, a payment plan. Unfortunately, often those payment plans are defaulted on. Sometimes when we're following up for the individuals, they've left the jurisdiction or we can't find them. We get mail that's returned from the post office because the post office box that they've given us is either somebody else's post office box or just incorrect contact details. So sometimes we can't follow up in order to ensure that they honor the payment plans that they have with us. Another reason is our charge master. Our charge master is a database of the fees that we charge to patients who access our service. And this is a public document that we provide to the Health Practice Commission every year. There's multiple pieces of legislation that impact that charge master, and I think that that's probably well known by all of you in the room. And actually, one of the recommendations that we implemented, I think it's 2 years ago now, from the Auditor General, is to put in place a charge master policy that spoke to all of the various pieces of legislation and how that fee index can be updated, because there are some services, such as the sale of the laboratory tests, that are based on the operation costs. But there are some fees that are controlled by Cabinet. So in 2024, we did a comprehensive review of the charge master, all of our fees, and we sent a request through the ministry to update the charge master for some fees that haven't been increased since 2014. As you all know, cost of living has increased. The salaries to staff have increased, but our fees have remained static for some services for quite a period of time. And I'd like to add that, the ministry has given us feedback that this is something that's being considered by Cabinet now. But also, I'd like to recognize that there are some business processes that we have that are not necessarily conducive to timely collection of the cost of providing the services. So we recognize that there are some bills that are not produced at the time of service, and that's something that we're looking at, that the business process, to see how we can do that better, because some of the services that we provide, the business process has it that the charge for that will drop after the result is produced. I'll give you an example. If you come in for a lab test, we don't charge for the cost of that lab test until it's resulted. So that means that it could be 2-3 days, or it could be 2 weeks, because that test has gone overseas for resulting. So we have to look at it from two different sides. As a payer, the patient will say, well, I want to make sure you got the results before I pay you, but at the same time, we've already invested in providing that service. So we're working on that business process to see how we can do that better. Also, we're looking at our patient flow. We've redesigned our patient flow to try to limit the egress from services, because, you know, once a patient gets seen in the clinic or in the emergency room, they just want to go home. They're not necessarily willing to pass through the cashier in order to deal with their bills. So, you know, there's other points of exit that we are trying to limit so that we can direct the flow of patients across the cashier. We are also looking at centralizing registration as well, in order to, again, ensure that the benefits are checked and the details are determined of the coverage before the patient goes in to access the service provider. But overall, we know that providing the bills in a timely fashion has been something that has been pointed out is an area of concern that impacts the reimbursables, and we recognize that, and we're working to see how we can improve on that. We are also working to strengthen our finance team as well, because services have grown, services have expanded, but there are certain support teams that haven't expanded. And the finance team is one of those teams. So we have actually outsourced some support from a private contractor to get us through this year's or 2025's end of year audit, with the intent of hiring additional resources in order to help us with some of the activities that are taking place, because a lot of our work, our back-end business processes are still manual in nature. And one of those, you know, some of the accounting is manual in nature. So while we are working with IT in order to improve our electronic data capture, we also are recognizing that in the meantime, there are some manual aspects that need to be dealt with. So we have strengthened the support team in that regard. So I know that was a lot, but if there's any other areas that you'd like me to focus on in particular, I'm happy to do so.
Thank you, Ms. Yearwood. You did go into a significant amount of details. So I appreciate that because there was going to be follow-ups and you've answered some questions. But I do have some follow-ups from that first one, which is, I know you've said thus far timing of collecting of bills contributes to this, because remember the original question was, what is causing this, right? And also, is it operational? Is it budget failures? And now the next question is, what are you doing about it? And I see that you try to, or tell us that you're trying to resolve it. And I got to say that I need a little bit more detail than we are working on it to see what we can do better. What specific things are you doing other than just saying we're working at it? All right, is there strategic shifts? I mean, I think more staffing on the back end for your accounting is a specific thing we can hold you account to. Is there something else that you are doing? Also, the charge master. I heard you say that cabinet is taking considerations to making some amendments. Now, whether you are collecting the fees necessary on that charge master is one thing, but the charge master would have been what it was when you budgeted for it. I think you're getting into whether there's more opportunity to get more revenue from it, which is a little bit different, in my humble opinion, as to whether your ability to actually have a deficit. So before I ask you any more questions about that, because I did kind of 2 or 3 there, and there's some other ones, so maybe you want to respond to those first.
Thank you. Through you, Mr. Speaker. So some of the specific things that we're doing, I kind of mentioned them, but I'll go through them again. So one of the things is to strengthen our finance team in order to ensure that we are capturing and we're actually billing on a timely basis. But one of the things that we're also doing, and we're in the process of recruiting for a cost accountant, is to go through and cost our services. Because whereas we're saying that the charge master hasn't been updated in some areas, we recognize in some areas what we have to do is to go through a detailed costing to ensure that if we're charging $120 for you to see the doctor, that it really does cost us $120. As you know, we're not here to make a profit, but we actually need to at least break even, right? So the costing of the services is something that's important because there's nothing right now to guarantee that the fees in the charge master, or even the fees that we're asking for the charge master, is adequate because there's been cost of supplies, cost of salaries, all of those things are inputs into the cost of providing the service.
Well, would you say then that your team in-house is doing a more up-to-date on costing on a timely manner? Because this is a yearly exercise, right? So if your supply chain has increased tremendously in your next budget, you're supposed to be able to say, we have to get more money for this because the charge is only this amount, but the supply and cost of it has increased. So is this a budgeting projection problem?
No, sir. Through you, Mr. Chair. I wouldn't say that it's a budgeting problem, but it's a costing problem. We have to actually cost. So what we're doing from a budget perspective, we're projecting the cost of providing the services based on the prior year. So we'll say, you know, it cost us $20 million last year. We're projecting an increase this year by X amount. But it goes down even further to the details of what we're charging, because we're basing that projection based on what we charged previously. But we actually need to go through on a costing basis, as you pointed out. Every year, we should be doing that. We don't have a cost accountant. We don't have those resources in-house. So that is currently the position that we're recruiting for now, so that we can help them prioritize the areas where we have a lot of services, and that they can actually go through and ensure that we are charging appropriately, charging adequately. Because when I say appropriately, it might seem as if, you know, maybe I'm charging more than I should be.
Yeah.
We know that we're charging way under the market, because we do market surveys from time to time, and we know the other providers, you know, are in the position where they can move with their fee structure, and their costs are different.
Well, thank you for that. And I just want for clarity that when I say budget, I mean budgeting is also expenses as well. So you're budgeting your revenue, you're budgeting your expenses, your projections of your costs and all that. So budgeting in its totality. So it does seem like it's a budgeting problem, whereby we're not adequately preparing for the whole cost component of the operation. So that staff, back-end accounting, and do you know when that person timeline for that hiring will be done?
Hopefully in the next couple of weeks, we will actually be able to appoint someone. And then I would say by, you know, the second quarter, we should have somebody in-house. That is a priority that board and ministry has been working with us on.
Okay. Thank you so much for that, Ms. Yearwood. About the charge master, I understand you said Cabinet is currently looking at it. Do you have any idea on timelines for that? Because we are now in the first month of the new budget. We don't want it to affect the next, this cycle budget. So do we have an idea of fix on that and a timeline?
I can't speak to that. I haven't gotten a recent update, but I know that the last conversation I had with Minister, she said it was a priority, and it was going before Cabinet. I can't give you any further update than that. Okay.
The other part that you said that was a bit of an issue was people not paying is a major problem. This one is sensitive because if they're Caymanian, I don't believe in pressure, and they got enough pressure as it is. But I did hear you speak about non-Caymanians and the problem of persons leaving island, people not at the same addresses, and so forth. How significant is that problem for you, as in numbers and as in dollar amounts?
I will ask you to ask that question to our CFO, because I can't tell you the exact number, but it is significant enough for us to be concerned. However, having said that, though, I must say that We have good interagency collaboration. You know, we're still looking for that national ID that will help kind of streamline things and help us get information, you know, that across the agencies. But despite that, we have a good working relationship with the Health Practice Commission. We report any individuals who are here on work permits that are not insured, because that happens from time to time. But often we see that there are visitors that are coming to the island that are not insured as well. And, you know, we have the mandate to take care of them, because often they come in an emergency situation, whether they've been involved in a motor vehicle accident or they've had a stroke or whatever, so we have to take care of them. In fact, I can give you an example that took place last year. We had a visitor who was involved in a significant motor vehicle accident, required significant care at the critical care level, and the care was going to be significant on an ongoing basis. So we actually cut our losses there, and we repatriated that individual to their homeland to try to reduce the amount of bad debt that we would ultimately have, because the individual
Have you brought
had no
this
means
issue
to pay.
sorry to interrupt, have you brought this issue to your minister and potentially onto cabinet as a significance? Because what I'm hearing and what the public will then hear you saying is that we're paying costs for outside people. Now, we are a very Christian-like society, and we want to take care of people, but we also got to take care of our own. So obviously, before you get into the significant numbers with your CFO, is this an area that you brought up to say we need to have a review on policy about this? Because the question is, of this overage of over $12 million, is that component a significant percentage of that overage and deficit or not? Are we talking about 1 million? Are we talking about potentially 5 million? What's the numbers? And so before the numbers come in, can you say, have you brought this to a review perspective with your minister?
The year has just started, and there are a number of things that we have on the agenda to discuss with the minister. All I can say is that at the time, the board was in collaboration with her when that incident took place. But have we sat down and looked at all of the details of that? No, we haven't as yet, but we have it on our agenda to do so, and minister is willing to meet and understand what that is. But when you ask about significant, it's significant in a day-to-day basis, but as far as the portion of that 12.5 million, I don't think it is more than $1 million or $2 million.
Okay, so you would say it's not one of the significant contributors to your deficit, but worth reviewing and considering, because one cocoa full basket to the deficit as well, as they say, right?
Absolutely.
So are you saying that there will be review, or can you give a commitment to this committee that you'll bring it to the attention of the board? I know you're kind of in a deficit of your board members right now, based on recent announcements of resignation, but I think it's a priority. The evidence you've given here today shows that we need to review that, and the minister needs to be aware of it too, because we can't be paying other people's bills. We got too much bills now as it is. So can you give that commitment that it will be brought to the agenda of the board?
I definitely will give you the commitment. However, I think the decision, the policy decision, is much higher than that, because, you know, when persons come into the emergency room, we don't ask their nationality. We take care of them, right? And like I said, many of these have been where they've come in through a motor vehicle accident or some other extreme illness. So we take care of them, we try to stabilize them, and then we work with them and their family to repatriate them. Just recently, there was somebody who came in who required dialysis services. We couldn't deny that dialysis treatment then and there because she would have died. So we provided the dialysis treatment, and then we liaised with her homeland in order to transfer her back to her homeland. So we try to do as much as we can to provide the care at the time that is needed, but then to stem the loss by
So it's a balance in that.
transferring. Yeah,
Okay,
because
so-
ultimately, I think when you say bring it to the board about a policy decision, the policy decision is really not a board decision. It's more government, cabinet. It is a
Moral
it is it's a right to care is.
Well, what I'm suggesting, Ms. Yearwood, and I agree with you, and I hope I didn't infer that it's more of a thing where probably we can decide not to do it because we have international obligations. What I'm saying is that we have to recognize it in respect to budgeting. Is there a projected expectation of 3% costing on loss of our international obligation?
Right.
So that the accounting general and those who police your money can say, this is expected.
Right.
It's all about budgeting and accountability. So, and there's always ways to tighten that up, international, standards and how they do it in other jurisdictions. Because other countries don't want to be terrible either if there's a Cayman in, say, for instance, Jamaica or somewhere else, and didn't have any coverage and they're in an emergency situation. I expect those countries to do the same. So I don't want it to take it wrong, but we have to plan, project for a sustainable approach to managing the cost associated with it. So allow me to stop there and ask the CFO to give us some of those numbers. And I will ask that if you don't have the full thing, that's totally understandable. But I do think that this committee needs a full outlay of that. So if you can provide it to our committee, if you don't have all of it today in an email format while we do our assessment of this hearing post in our results of it. So I'll allow the CFO to go ahead now.
Thank you.
May I ask you to state your name and position before you say it?
Thank you, sir. Sheila Thomas, CFO, HSA. To respond to your question through you, Mr. Chair, the revenue from self-pay, those are the ones we're talking about, it's 6% of our revenue.
Okay, Ms. Yearwood, maybe you want to add on to that because I don't think that fully answers my question, which was, you said 6% of your overall revenue comes from persons who are non-Caymanian or visiting?
No. By persons who we consider self-pay, that means they are not properly insured or their insurance has lapsed, so they are liable directly to the HSA because they don't have insurance coverage in place.
Gotcha. Those ones who need to be billed and you got to figure out how to get the money from them.
Right.
6%. What amount does that equate to in dollars of your budget? Because if your budget is close to 200 million spending, that's what's that, $12 million?
Yeah, just over 10 million.
Ooh, so that's a lot. Yeah, Ms. Yearwood?
Just to clarify, I think the self-pay is not just the expatriate population. That could also include Caymanians. So one of the things that we want to do in the next budget period is to review our outputs, to review them to determine where are their gaps. Because if we are mandated to provide care, regardless of the ability or the means of individuals, then we want to present to the government those outputs and gaps, right? Because, for example, accident and emergency, we don't have an output for accident and emergency. If you look at all of our outputs, there's a gap there. So even Caymanians coming into the emergency room who's uninsured are provided care. So it's not just the expatriate population that default on the promissory notes. Caymanians do as well.
I agree with you.
And so that then falls as a bad debt for the HSA.
Fair enough. And I agree with you there. I think that what you would have is a more sympathetic viewpoint from cabinet to cover those for Caymanians, but I don't think the sympathy would be there for non-Caymanians. So the question I asked you was about the non-Caymanians. So of that over $10 million, do you have it broken down into Caymanian and non-Caymanians?
I think we need to do that, and we can provide it. Oh, you have it? Yeah, I think we'll provide that afterwards. We can break it down by nationality. We can do that afterwards.
I thank you for giving us that commitment because it's going to be a major question for you. Ms. Yearwood, I'm going to move on to the next section of questions because my colleague did have an appointment who was going to lead the charge on that, but she's asked me to do it for her. So can you give us the HSA's plan to achieve financial sustainability, which is some of the things I've been talking about to make sure that we can plan properly to address this pattern of operational losses over the next 3 years, but particularly this budget year and the next one.
Right, thank you for that question. As I explained earlier, some of the things that we're doing in order to reduce the bad debt by refining our business processes, ensuring that, you know, we look also at our staffing, that we are only, you know, we maximize the staffing as much as possible, despite the fact that we have a large population growth. We look also at our expenditure. We're looking to identify, you know, what are the areas that we can do better and we can reduce costs, where we can improve on our sustainability. So we have solar panels. We try to do things as environmentally efficient as possible. We are also looking at how we can ensure that we reduce the cost of providing other services as far as our inventory is concerned. So, you know, there's a number of strategies that we have rolled out and are in the process of rolling out to ensure that we reduce the cost of providing care. And we, you know, at least break even this year. We're projected to have a small profit, and we hope to expand upon that for this year.
Thank you. You said something earlier, Ms. Yearwood, about...
Mr. Bryan, can I just ask you to hold 1 second?
Yes.
You were trying to get my attention.
Yes.
Just a quick question. This is good morning to both of you. Good to see you and Happy New Year to you both. Question I had was with regards to timely submission of insurance claims. I recall I've had this happen on 2 occasions. One was with the HSA a long time ago. Family member passed away, and a year and a half or so after the event, I received requests for payments for insurance submissions or insurance claims that were not submitted timely and were refused. Obviously, I had a conversation and said the person is no longer here, sadly, and I wasn't willing to then pay because it was no fault of mine. What's the situation with that? Now, do you have very many of those, or have you been able to put processes in place to make sure that insurance claims happen timely and you don't find yourselves susceptible to those kinds of losses?
Thank you very much, sir. Through you, Mr. Chair. Yes, that is a recognized weakness that we've had over the years, and we are closing that gap, and we will continue to do so in regards to the review of our business processes, because some of the timeliness was because of the way that when the charges are dropped. But recently, I checked with the CFO and our team. We are providing statements now to insurance companies within 30 days. So that is improvement. I'm not saying that there's not the one case here and there that falls astray, but that is definitely something that we're working to ensure, because we recognize that, you know, if the persons have the insurance need to pay them, because sometimes they move on to another business and they no longer have that insurance. So, you know, and to be fair to the insurance companies as well, you know, they have to be able to pay out when the services have been incurred from their business process. So yes, it has been a recognized weakness, but we're working on it. It has gotten better, and we hope to continue to improve on that.
So I'm hearing 2 things. I'm hearing that it's a recognized weakness and improvements are happening, but I'm also hearing that the problem is not a small problem. It may be 1 or 2 things that slip. So which one is it? Is it if it's 1 or 2 things, it may not be an issue. So which one is it? Is it still an issue? The incident that I referred to, by the way, was 20-odd years ago. I really am hoping between that time and now that problem would have been resolved. So is there still a real problem or not?
No, through you, Mr. Chair, it has improved. We are billing within 30 days, but what I'm saying is there may be an isolated case. For example, you know, there may be something to do with, you know, waiting on the charges to come in from overseas for an individual, so it may extend beyond that period, but largely we are rolling out our bills in a timely fashion.
Mr. Chairman, through you, I noticed at the end of last year, the HSA, well, according to the budget documents, was forecasted to have more than 70 million outstanding in accounts receivable. Of that 70 million that was in our receivables, how much of that related to the insurance companies?
Through you, Mr. Chair, I'll need to refer that question to our CFO. I don't have that number on the top of my head right now.
Yeah, no, that's fine, because I know that there are some insurance companies that just don't like to pay. And I can say that as a former member of the board, I remember when billings were going out, some insurance companies had the audacity to send the bills back unopened. In other words, it wasn't even going to look at it to even pay it. And I know many Caymanians are struggling with some particular insurance companies that needs to be shut down. God knows how they still have a license, because they're not paying anything. And I understand you need to maintain a good working relationship with people in the healthcare industry. I don't. So I can speak a little bit more bluntly, because I know some of them don't pay. And I find it hard to believe that some of these very same companies that would owe the HSA are actually still paying on time. Because it also, a lot of them, some of them I know, I think have cash flow issues, which also impacts the HSA cash flow issues. So I'd be curious, so in terms of what those accounts receivable after 70.5 million, because what I noticed also is that the bad debt provision was also 41.5 million. So in other words, no, that is money that you basically don't expect to get back at this point. And that is a significant amount of money.
Yeah.
So, sorry, it sounds like you have the answer there for your CFO as the answer.
Through you, Mr. Chair. Thank you for that question. While I don't have the exact dollar figure, I could give you in percentages and commit to give you the exact figures afterwards. But the composition of our receivables shows that commercial insurance was under 10% of our total receivable balance, which would be the external ones. The bulk of our receivables, roughly 70%, was between CIG and Cynical.
Okay, so basically talking about 7 million, 10% of roughly 70 million, 500,000 is roughly $7 million.
Yes, sir.
So, and how much of that 7 million roughly what's the aging of it? 30 days, 90 days? What's the aging of it?
For the 2024, I would say it was spread pretty much across the buckets, the aging buckets.
So then you're talking about maybe roughly half of it, then it'll be well over 90 days then?
Potentially, sir.
All right. Well, in case members don't realize it, since many of those insurance companies are regulated by SEMA, SEMA also has certain requirements that after 90 days, those things will be treated a little bit differently. So good luck collecting that money.
Thank you, Mr. Chairman. I think the member just highlighted something we as a committee may have to take off in respect to assisting with collections, because there's only so much HSA can do if people are not paying by way of insurance. It's our obligation to examine whether the other authorities who license them are doing their part to assist in this collection component. So I hear you. Ms. Yearwood, before we went into a different line of questioning, I was getting to the fact that you said we normally undercharge. And I think what you mean is we charge a lot less than most of the other hospitals, and naturally so, because we're the primary facilitator and of services to Caymanians. And as you said, you're not in the business of making a profit. But with that in mind, it concerns me of what I talk about is the long-term sustainability of healthcare services offered across this country. I see that we've recently gone into vascular surgery, expanded the oncology and dialysis, which is tremendous in Cayman. But the question is, if we're not being able to collect as much, the expansion of these areas, capital outlay, land purchases, staffing, which we're going to get to, because I think staffing is a major component of cost, it's about the sustainability of all of this, particularly when there's other offerings on island. Can you explain to me why are we expanding in other areas where it is showing adequate services available that we can refer locally? I'm lost to the logic there.
Through you, Mr. Chair, as I said earlier, we follow the mandate of the Health Services Authority Act and in alignment with the WHO principles for what a national provider should have in order to ensure the resilience of healthcare for the country, right? Having said that, though, we do collaborate with the private providers. In fact, there's discussions that we're having now with both of the hospitals regarding that same service, the vascular surgeon, where we are looking to see if we can utilize facilities, and because there are things that we need, there are services that we need to service the patients that we have. For example, dialysis, right? Mm-hmm. Oftentimes those dialysis patients require fistulas and vascular services that ensure the continuity of their care. So we do want to provide continuity of care, but we do collaborate with the private providers to use their services or to combine efforts in order to take care of the patients.
Okay, I do hear you about the the World Health Organization obligation to providing the basics. But providing doesn't necessarily mean you have to do the operations. You have to ensure that it's available. It is available on island, so I'm getting into the cost factor. Mm-hmm. So because you're obligated to make sure it's available within our country, that doesn't mean HSA has to do the job, because the more competitors, I'll tell you my humble opinion, the more competitors that we have in these services, the more expensive the product is going to be. We only have a certain amount of population. So I was really confused when HSA went into competition with, say what you want to say about Health City, but that's their main focus, is heart and vascular surgery. You got I think it's Doctors Hospital now? What's the name of it? I think it's called Doctors Hospital, who are they're expanding, and then you have other small private areas. So I'm wondering if there's been a proper gap analysis done, and I'm going to ask you to tell me when the last time that was done, because I have the ESO stats here as to where you're at with that, and I don't think that there's been enough analysis on where the HSA is going and why. I have yet to look and see what the justification for expansion, because what it says to me at the end of it is it's going to cost us more money in the long term when we can have those services done elsewhere. So maybe you can just respond to that, because this is a lot of positioning by myself personally.
Mm-hmm. I respect that. Through you, Mr. Chair, I respect it from the layperson's perspective as well. It may seem like HSA doesn't need to do this, but remember where I started off. I said we need to make sure that we provide a resilient service that is sustainable, and what we have to ensure that we are doing is that we provide those services when they're not available in the private sector, because sometimes in the private sector those individuals aren't on island. And the patients fall in need. So if we don't have those services on island, then we need to send them off island. There is one specialty where there's 5 on island at any one time, but there has been times when there's none. So it is something that I think we need to collaborate further on to ensure that if we do have the specialties on island, that they don't all go on vacation one time.
So you're saying then that before you went out and did the expansions in these areas, that assessment wasn't done already?
Absolutely. We do a business analysis for any one of those service expansions. And going back to the earlier question that you had about when did we sit down and look at our services and look at a gap analysis, as recent as last year, when we did our strategic planning at the beginning of last year, we looked to see what are the services that we are providing, what services are in the private sector, are there any services that we're providing that we shouldn't be providing, and we've gone through that as recent at the beginning of last year.
And you're saying that there's not enough services in those areas that you've expanded to? Is that what I understand? Just want to make sure I'm clear if I understand.
In order to make sure that we are sustainable and we have a resilient healthcare industry, yes.
Okay. With that being said, how do you balance the pricing comparison? I'll give you an example. I am fully aware of a number of circumstances where we have it within the hospital, which I think the expansion, in my humble opinion, is not necessary, but also other local providers, and then we send people overseas to other institutions. I'm not going to call any names, but I think we are fully familiar with your partnerships overseas, and you check the prices, they're more expensive than they are locally. And that goes back into the deficit and cost factors. So can you explain that? Why are we sending people overseas, which comes with flights and hotels and all the other variables, and even the services costing more?
Through you, Mr. Chair, our physicians are not in the business of providing the receiving facility, right? So the physicians will say this individual needs X. They need to be referred out for X. The referral then goes to the insurance provider, who determines within their network where the patient goes. So there are times when the patient has to go overseas, and it's because even though we provide the service locally, sometimes there's a nuance for that in that service that individual needs that's different than what we are providing locally. I know that there are sometimes, and again, this is not HSA's jurisdiction, I'm just telling you what happens, right? It's within the hands of the insurance company.
Including
but I know
Cynical.
that there are some patients that would have had a long-standing relationship with an overseas provider that they will honor because they have a very complex medical history, and that's honored. But I can also tell you that there have been times when the insurers have said, no, we need to provide those services locally because it's available locally, because, sometimes the patients don't understand where the responsibilities begin and end. So they will call me up and, and ask me to intervene. But it's not within the HSA's responsibility to determine where the individual goes. We only determine that the need is required. And sometimes the physician will advocate for that patient because of the nuance in their medical condition. They may, say that this individual is, a cancer patient, but this is what is needed and this specific thing isn't available in Ireland. And I'll go as far as to say that our healthcare professionals across the island, they collaborate very well. They attend CMEs together. They attend, conferences together. So our doctors know what services are available locally, because not only, do they provide that information to our referrals office, and the insurance companies, but they also, talk amongst themselves, so they know what's available locally. And the doctors will say the individual needs X type of treatment. It is then up to the insurance company to decide where the individual goes. We are involved in helping to advocate for the patient. I'm dealing with one such case right now where, it's a very complex case and there's multiple stakeholders involved, and sometimes you just need somebody to pull all those stakeholders together. But as far as the cost, determining the cost of where the individual goes, that's not within the HSA's remit.
Thank you. It gives me an indication to kind of examine what's cynical, because we can't tell what other insurance companies are doing, or whether our own other government company is not deciding a more expensive place just for inappropriate reasons. So I apologize for putting that on you. Yeah. And by the way, Ms. Yearwood, you're doing an amazing job. I'm just doing my job too, so don't feel anyway. Let's move on now to about 2 or 3 more questions before my colleague takes over here. Are you comfortable with the current funding that has been projected? There is a $25.6 million budgeted for you. Is that adequate enough?
That's
Additional.
a trick question, Mr. Chair, because we talked about this earlier. We project the cost of providing services, but all of you know how the budgeting process goes. And I explained earlier that we have two types of outputs. One that is an episodic basis, so we can come back to Finance Committee to get additional funding if the cost of providing care to indigents goes over what is funded. But there's also the program outputs that are supplementary funding for programs that we do. And I did explain earlier that even with the funding and what we collect from providing those services, it's still not sufficient to provide the cost of care, to fully fund the cost of care. And having said that, I also mentioned about us having to do a costing exercise, because that position is based on the current fee structure. But we know that the current fee structure, the inputs into that fee for any one item has not been reviewed in its entirety. And that is an exercise that our board and ministry would like for us to do, at least to be able to say, this is truly the cost of providing services, not just projected based on last year's or prior year's utilization, but it's truly because we've actually costed all the inputs that go into that service. So I'm not saying that, that by doing that is going to allow us to charge more for the service, because I recognize that Cabinet has a role to play in determining whether or not those fees can be increased, because whenever we increase our fees at the HSA, it impacts the cost of living, because all of the insurance, even if they've just and I'm sorry that I'm not throwing anybody under the bus, but sometimes we know insurance companies have just raised the premium, but HSA raises the cost of providing the services, and the fee is increased again. So we recognize that the Cabinet has a role to play in determining whether they approve or charge master, because that's going to impact the cost of health care and ultimately the cost of living, right? But at least we can say it, because right now we can't say with any confidence. I can't tell you with any confidence that I'm charging the right fee. All I can say, there's been many years and it hasn't been increased. Cost of living has increased. The cost of providing the services have increased from the salary perspective. So I'm pretty confident in saying that it's not adequate, but I can't tell you by how much.
Gotcha. So
if we can tell you, we should be charging $10 million more, then it's Cabinet to say, okay, we don't want you to charge $10 million more. We will work out an arrangement with you to supplement that cost. But right now, we can't with any confidence tell you that we are providing care at the right cost.
Monsieur Wood, I'm going to hold there. My colleague has a question in respect to the specific area, but I'll come back to that in a second, okay?
Sure.
Sorry, through Mr. Chairman, just followed on to something that the CEO just said. From what I understand, the system is set up where there's a set thing called a standard health insurance rate.
Yeah.
And that is the maximum that an insurance company is obligated to pay for a particular service. So if the SHIC rate, I think that's the SHIC term that they use, is say 16,000, shift, yeah. If the shift rate says 16,000 for, say, a knee replacement, it means then that even if the doctor is charging 40,000, the insurance company is still only obligated to pay the 16,000. Now, it is my understanding that those shift fees have not been increased in more than 20 years. So if the costs have not gone up where the insurance companies are obligated to pay, then I'm trying to understand what is driving the increase in premiums when the shift fees have not gone up in 20 years. But insurance premiums have gone up like crazy over the last 20 years. So what is driving the cost of the insurance companies?
Through you, Mr. Chair, the short answer to that is utilization, right? Because we have more providers and people are utilizing the service. But you made a very, very astute point about the standard health insurance fees is all that we can charge, but it doesn't mean that that's the cost of providing care. So in all fairness, the Health Insurance Commission will ask us, all the providers, what are our fees, what are the costs that we provide or we want to charge, and then they will then do their actuarial, outsourcing to determine what is the cost of those fees. And you're right, in some areas, it's not across the board that they haven't been increased in 20 years. In some areas, they haven't been increased for a while, but I think they did increase some last year or the year before. But in order to be able to inform the Health Insurance Commission, we need to have that costing done. We need to know what it costs in order to provide the service to inform them so that they can then do their actuarial calculation and determine what is the fair reimbursable rate. But going back to the final question that you had about what is driving the cost, it's utilization. There's people will come to the HSA and then they want to go for a second opinion. They doctor shop quite often. So I feel that whereas it's probably a lot more than that, that's one of the things, utilization.
That's an interesting point. Doctor shop. I think we need to analyze that because that sounds like cha-ching to me. And it costs us money, and we have to recognize that that's a serious thing. In other jurisdictions, you don't get the luxury to doctor shop. And I know it's something that we here in the Cayman Islands like to feel comfortable with who our doctor is, but we have to have a little bit more faith in the system.
Thank you.
Probably not the thing that we want to talk about too much.
Can I just mention one point?
Yes,
I think
please.
that this is really important. I think we, as a country, have to be very, very proud that all 3 hospitals are JCI accredited. That means that they have met international standards for safety and quality. So to your point, we need to have faith in the system and not in Dr. Google, because a lot of people come into the hospital and say, I want an MRI because that's what Dr. Google has told me I need for my headache. So you're right. We have to have confidence. These are highly skilled professionals that we hire here in the Cayman Islands. And then the infrastructure that supports the professionals has met international standards as well. So there's no reason why people need to go overseas because they don't trust us. There may be services, there may be a piece of equipment that we don't have that they need to go overseas for, but ultimately they need to trust the local providers. And I must say, it has gotten a lot better over the years. We have had feedback from patients that have come to us after going overseas, and they've said, you know what, the care that I was provided at home was better than I was provided overseas. Or the other comment that has been said, in fact, we've seen it in social media just last year, the doctors overseas are saying, without the care that was provided in the Cayman Islands, your loved one would have been dead. In fact, we don't need to do much more here because the Cayman Islands did such a good job at stabilizing and providing care for your loved one. We do provide excellent care here in the Cayman Islands, and I'm confident that I could receive care in any one of the facilities without having to go overseas.
So, to you, Mr. Chairman, to the CEO, earlier you mentioned about the cost going up because of utilization. The last time I checked, I think there were about 180 registered practitioners on island. And some of them just basically set up shop, cherry pick, and so forth. And when you have that much healthcare providers registered that we know of, 180, 180. And bearing in mind, you got the major 3 hospitals, HSA, Christy Tomlinson, and LCD. And then we have all the other doctor's office that we know of, the Marizukas and so forth. Where is this other roughly 160, 170 coming from? And the reason why I ask that question is that when you have this much providers in a market that is this small, and they all need to make some kind of money. This is where people start referring procedures or looking at stuff that people don't need to do. So yes, there's overutilization, but the question is this utilization or the suggested utilization or referral has to come from somewhere. So the question is, having all of these different shops, how does that impact the HSA operations and other hospital operations?
Through you, Mr. Chair, that is a very, very good observation. So as far as the cost of providing care, you're right. I mean, there could be, the overutilization doesn't necessarily just come from the patient. It can also come from the provider, ordering more tests, providing more follow-up consultations. So it is a multi-pronged problem. And you're right, with the growing number of providers in the island, you have to anticipate that there's going to be growing utilization because they have to market their service. They have to be able to, break even as well.
And that is exactly where part of the problem is, because some of these shops need to keep their doors open, and all of a sudden now they're basically recommending or referring all different kind of stuff for this one to get that one to get that kind of stuff done. And it's driving up utilization because at the end of the day, even the way the government system is set up for civil servants, if you want to go outside the network, you have to go and get a referral. Whereas now, so the referral issue is still a major issue, as my colleague from Georgetown Central touched on earlier, in terms of the whole referral issue. So that is one of the things that needs to look at. And like I said, I think part of it is still our government policy to start looking at all of these guys who come in and set up these shops who are just basically flying in. And we see the services advertised in the newspaper all the time. Well, this one is an island, that one is an island. Bearing in mind that these people are just flying in, grabbing business and go. Yeah. And they're not contributing to the local economy. So a lot of that stuff has to be factored in, but I know that's not something for the HSA to deal with. But at a minimum, I need to put that out there in the universe so people can understand that this is a reality of what we have to deal with healthcare in Cayman. Thank you, Kenneth, for yielding.
Thank you, member. I am very mindful that my colleague from Prospect has some questions, so I'm just going to, sorry, colleague from Red Bay. Yeah, close enough, as they say. I want to get some quick fire questions. Do you think this country has too many providers? Because it gets into the utilization component, which causing what we are perceiving to be the increasing cost.
Mr. Chair, I can only speak from what I know anecdotally. I have not done that analysis. I believe that that's better done at the Health Insurance Commission, who knows all of the groups and how many people and what is reasonable for a population of our size. So I can't answer that question with any sort of confidence.
Do you think the Health Commission, and I'm sorry to put this question on you, ideally you're not supposed to have to answer this, but Ms. Yearwood, you are known to be one of the leading health experts that us in Cayman look to. So asking you means something. You don't have to, because it's not really in your remit. But the public would like to hear what Ms. Yearwood would say. So do you think the Health Commission should consider a review of, do we need to expand any further in some of these? Because most people would say, the more competition, bring down the prices. But that's not exactly how it is in health. And then when you have too many, they all try to bring up the price just to make enough to cover the cost. And setting up a hospital in the Cayman Islands is very, very expensive. And it gets into what my colleague was talking about, making recommendations for procedures that you really don't even need. So again, I'll ask your humble opinion. If you don't want to answer, I'll respect that.
Yeah, no, I think that the cry from the clinicians over the years has been for the review to be done. I'm not sure whether they're in the process of doing that or not, but, and I'm not so sure how easy it is to set a threshold for how many OBGYNs should practice in a jurisdiction of our size. I mean, if there's any sort of, international benchmark for that. But there has been a cry from the clinicians to say, we as a country need to look at how many practitioners that we have here, because there is the competition does impact every one of us.
Thank you so much. Can you say when was the last government strategic policy on healthcare?
The Ministry of Health. The Minister of Health is currently working now on a strategic plan. I know that they met just last week, and they had some follow-up questions that they passed on to us. HSA is doing our strategic plan in 2 weeks' time, and the Minister is going to be a part of that as well.
When was the last one done?
The last one, I think, expired in 2017. It has been a while. At least the one that's been published.
The one that was expired, when was it actually done? Because normally they go for 5 years. As my memory serves me right, I think Mark Scotland did the last one, which is around 2011, 2012.
That's correct. I think, yes. I looked at it recently and it had his picture on it, so it would have been.
Yeah,
he was
so
a minister at the time.
In that sense, then, since 2011, 2012, since Mark Scotland have left, there have been no government update on healthcare policy.
Nothing written, I suppose, but whenever the HSA does their strategic planning on an annual basis, we review and make modifications on an annual basis, and each year we request a directive from the ministry. How is it that you would like to see the HSA go for this year? So we always touch base with the minister, whether there's a written plan or not. We touch base with the minister and ask for a direction that will help guide our plan, because we need to support the ministry's vision or government's vision on a whole for healthcare.
But that is exactly where the challenge is, and that's the crux of the matter, because at the end of the day, the HSA can only focus on the HSA's operational issues. The broader public issue of healthcare needs a national policy, and the Constitution is clear. That is the remit of Cabinet to set the policy. So as sad as it is, it basically means that every healthcare minister or every health minister since Mark Scotland, in essence, and it has expired, as either basically not done the job that they should have done. And that's just the reality. And you can't say it, but I can say it, but that's fine.
Yes, sir. Through you, Mr. Chair, you're right. We need that guidance because we want to make sure that our plan dovetails into the ministry's plan or the government's plan for health. But I must say that I'm very excited and very encouraged by some of the plans that the minister has been communicating to us, because I know that the overall review is from a national perspective, and there are things that she wants us to do, to collaborate, to work together. But also, the minister is very data driven, and she's looking at ways for us to actually get better data on an ongoing basis, and that is with the movement that we are taking now for public health, so that we can actually. I mean, the STEP survey was done, and we have information from the STEP survey that says what is the state of the country, but we need that information on an ongoing basis. So just like having, and I know that you're familiar with healthcare because you've sat on the HSA board and whatnot before, so. Just like we have, I just lost my train of thought.
Well, I help you to get it back on your train of thought then. Well, their focus on, or your organization is focused on the data. There's one data that I'm focused on. Mm-hmm. Is it the census that we did? And one of the things I noticed is that when I look at the top 3 or the top 5 issues within the healthcare that affect Caymanians in this country, those are the things, or those areas, especially like diabetes and so forth. Mm-hmm. When you actually look at the standard health insurance coverage, those issues are the ones that are basically the things that are not covered. You take, for example, optometry, people with the eyesight, things that are not covered in many insurance plans. Those are within the top 5 issues that are facing Caymanians, or the things that are not covered by the standard health insurance coverage. So if you want to start there, take a look at the census. Now, I recognize some of these issues are lifestyle issues, don't get me wrong now. I'm fat for a reason. I love oxtail, the curry-goat gravy, and the rice. I get that. You know, and at some age, doing it at 25 is one thing, doing it at 50 is a different thing. But looking at the top illnesses that are affecting our people, you know, I mean, we need to now cater our old insurance coverage and healthcare coverage to those issues. You know what I mean? So it is, you know, cardiovascular is still there, diabetes is still there, you know, glaucoma, all of those kind of things is still there. So at the end of the day, as you're going through this exercise, at least focus on the ailments that many Caymanians are facing, because at the end of the day, those are the kind of stuff. And like I said, diabetes has become a big issue. You know what I mean? And a lot of it I know is lifestyle, some of it is genetics and so forth. But again, when you look at the amount of visits that people are allowed now in the actual insurance coverage, you get 1 or 2 visits a year. Those are not sufficient visits to detect some of these issues, especially the major issues that we have. And by the time you show back up 6 months later, you can end up losing a foot or a toe or something. So at least if they're going to be focused on that, at least use the census and start looking at that, because the ESO did a good job of going around and collecting all the information. The public did a good job incorporating, giving us all of this information. And the least that we can do now is show the public why the census and why these surveys actually matters, because we actually use them to make a decision.
That's right.
But if you're going to sit down there and go 13, 14 years without even a healthcare plan in this country, people at some point is going to sit back and wonder, why am I answering all of these questions if nobody's going to be doing anything about it?
Sure. So
Okay, go ahead, respond.
Can I just, because I remember what I was going to say now. Through you, Mr. Chair. So you're absolutely right. The STEP survey was actually Ministry of Health and HSA that did the STEP survey to determine where we are as far as those lifestyle related illnesses. And it's no surprise, like you said, you know, our diet, our lifestyle has led to those problems. But what we are doing in order to respond to that, we're working very closely with the Chief Medical Officer in the Ministry of Health to work with schools and workplaces to teach about, you know, nutrition and the importance of changing lifestyles, so that we're taking it from different angles, the education part of it. We're doing more testing, more screening. We're actively out there at, you know, lots of different fairs, and we go into workplaces as well and do screening. We go into workplaces and do education, and we're also putting kiosks in various businesses and public places, so persons can do their own, check their own blood pressure to make sure that, you know, that they're okay. And we are now working on a national registry for the first time. I mean, the last couple of years, the ministry has been working with our public health department, because we haven't been able to say that, you know, this is the number of hypertensives that we have in the country without a survey. So what I was going to say earlier, let me say it before I forget, is the registries have to be updated, but we have mandatory reporting of certain illnesses. Communicable diseases, for example, is reported every day without anybody asking question. Everybody knows, every provider knows that if you find somebody who has TB, what you have to do, you have to report it. And we have a national registry that says how many persons with TB have been diagnosed within the island. But also, the ministry is looking to work with public health to have mandatory reporting of non-communicable diseases as well. And it helps because right now, HSA has been functioning. Public health has been functioning under HSA, right? So there are providers that are saying, why should I tell you how many hypertensive come into my office? Because you're a competitor, right? So that's the reason why the minister wants to put public health under the ministry. So it's from a national perspective. So there's no question what Doctors Hospital or Dr. Marzuka, since we've mentioned those already, they won't have any issue reporting to a national body. So that's one of the things. There's lots of really exciting things that are coming downstream from this. And one of them is the HEARTS program, where there are persons who are living with hypertension and diabetes who are not taking their medication because, you know, they don't have the means to do so. Because even though we have outputs and we have, you know, other support systems for individuals, we know that we are a very proud population and we don't like to ask for help. But this is something that is going to be done on a national basis. I don't have all the details of the program because we're meeting to plan the implementation of it in the next week with the CMO and the CNO. But it's to make basic medication for hypertension and diabetes available to individuals, all individuals. And then one day, I'm sure that the standard health insurance contract benefits is going to be reviewed. I haven't had those discussions with Minister, but I'm pretty sure that that is something on her radar as well, because there's been a lot of advocacy from the public to expand that list of benefits, but recognizing that once we expand it, there's going to be an increase in cost, and we don't want to increase it to such a level that then it's not affordable or accessible by, you know, the persons that are living and working here on work permits, because that cost then has to be borne by their employer as well. So yes, the standard health insurance standard health insurance contract definitely has to be reviewed and updated, because right now it is horribly inadequate for outpatient services. It's mainly an inpatient plan, and there's some elements for wellness as well, but it's very inadequate.
Well, I'm actually very happy to hear that they're finally getting ready to pull public health out from the HSA, because that's one of the biggest things that have actually led to many of the other hospitals not wanting to report what's going on in their hospitals so as to get a better look. Because if you even look at ESO statistics, for example, they only give you of what happens at the HSA and none of the other hospitals. So I'm very happy to see that that is coming out, and then hopefully we can start getting a proper national look of what exactly is going on inside the country. Yes. So thank you very much for that.
Yes.
Mr. Chairman, I've been really trying to get onto to my colleague's area of questioning, but I think it's important that I highlight some stuff that I don't want it to be lost, that the last minister did majority of this work already. And I know that we have examined that we haven't had a strategic policy on health in a while, but I can stand testimony as witness today that it was started in respect to the last administration. Say what they want to say about the last minister, but there was a lot of work done. The process of bringing we call it under the ministry was also started there. So I don't want it to be lost as that. To be honest with you, I think the current minister should be quite happy that most of the legwork is already there. Should be quite easy exercise for her. But I'm not into getting that done. But I'm happy to hear that we're going to be, hopefully within this 2-year budget, we will see a national strategic healthcare policy. Do you think that that is possible?
Through you, Mr. Chair, yes, I did say that they met just last week to look at the national strategic plan for health.
Looking at, sorry, Ms. Yearwood, I'm going to be straight to it. Looking at it and actually having a date for completion is two different things. Do you think they're going to have one before the end of this 2-year budget?
Yes, sir.
Thank you.
Yes.
I'm going to do this last question now and then hand it over to my colleague in Red Bay. Do you plan to go into any other services in the near future from an HSA perspective?
Through you, Mr. Chair, like I said, our strategic planning retreat is going to be held in the next couple of weeks where we will examine that. But at this point in time, in talking to the senior managers, there is no area that we're looking at other than galvanizing what we have now. That's what we want to do. Like, for example, primary health care. There's no secret that we need more GPs and in order to ensure access, right? So we're just looking at galvanizing so that we can ensure that people do have access to the care that they need, especially primary health care, because we don't want to leave it until they require more intricate specialist care.
Okay, I have some questions about post-retirement healthcare obligations, but I'll come back to you. I want to allow my colleague to go into his line of questioning, and I'll catch up with you in the next round. Thanks.
Thank you, colleague. Thank you, Mr. Chair. And before I do that, though, before I leave the line of questioning I just finished, the last two lines of questioning I just finished, I have a request. The insurance, submission of insurance claims that we discussed earlier. It would be helpful, I think, if you could submit to the committee the number of incidents over, let's say, 2023, 24, and 25. Number of incidents where insurance claims were submitted late, and the total dollar value of that, just so we can get a gauge as to where things stand now and if there's been an improvement over the years. I think that'd be very helpful. And the other question I have before I move on is, you mentioned earlier on in your testimony that you were strengthening the finance team. The inference I got from that was that it may be understaffed, so you're looking at increasing staffing. So if you could give me some idea exactly how understaffed are you, and how soon would that additional staffing be in place within the finance team?
Through you, Mr. Chair. Yes, we have some key positions that we need in order to strengthen the team, and one is another deputy CFO. So we want to have one deputy CEO that's in charge of the reporting, and another one who's in charge of operations, because it's a huge entity that we have. We've grown a lot. And like I said, those support services haven't grown while the provision of services have grown. Yeah. We're looking at a cost accountant as well that I mentioned earlier.
Yes.
And then a bank reconciliation officer, because right now that role is carried out by the accounts manager, and it takes her focus off of the day-to-day work that she needs to do from a reporting perspective. So those are the three on the top of my head, and I know that there's one more. But those are key positions, and Auditor General and his team have also pointed out some of these areas that needed to be strengthened in order to make sure that our reporting is happening in a timely fashion and the quality is the same.
Thank you for that. This actually plays into the next line of questioning, but in terms of strengthening the finance team, how happy are you? I know you, in terms of the skill sets with the people you have there now, and the experience. Because what we're going to be getting into next is issues around potential failures within financiers. How satisfied are you in terms of the skill sets and the experience that you have there now? Has anybody vetted to see if there's anything else that's lacking?
I think that the area that we really need to focus on is to help the finance team as well, is to help with the automation. I mean, we are heavily manual in our processes. As you know, our accounting system was part of government's until just 2 years ago, when they went in another direction, and we're in the process of implementing our own accounting structures, and that was something that hadn't been completely refined and rolled out before the end of year, and that led to a number of the adjustments that we're seeing in the 24 audit, and those are some of the areas that we want to try to galvanize to ensure that we have technology that's working with us, so that it will complement the team instead of us making consideration for that.
Quick
Thank
question.
you. My colleague has a question. Continue.
Oh, thank you, Roy. Quick, through you, Mr. Chairman. How many people are in the finance team as it stands right now, as a complement?
Can I refer that question to my CFO, because I don't have that number on the top of my head.
Through you, Mr. Chair. Core Finance, which would be the primary team that does the reporting, that will be 5, 7 included myself and the deputy CFO.
Okay, and the Patient Financial Services group or that team, where do they sit?
They report into finance.
And how many people are in Patient Financial Services?
Approximately 30, with 3 teams.
And Patient Financial Services, what do they primarily do?
They do all our billing, collections, denials management, follow-up.
Okay,
All the back-end functions.
I'm going to put something in the universe now. So you're talking about 37 people roughly on the finance as it stands right now. 80% of your revenues come from central government. So this is what we call spaghetti on the plate from where I sit. And having this much people focus on billing government for spaghetti on the plate doesn't seem like the best use of resources. And the reason why I raise that issue, and this is something that the CEO knows that I am concerned about, when you look at OECD countries, I think about 30-something of them or whatever, and we did an analysis that broke down hospital costs between clinical and non-clinical. Cayman did not come out exactly where it should have been. So to kind of give an example, in most, and again, I'm going by memory, when we did the analysis, most OECD countries, roughly about 11% of their costs was administrative, 11, 12%. The United States was the worst, with around almost 20% of their costs being administrative. When we did the same exercise with the HSA, it was roughly 50-50. And on top of that, if we were to take public health out, as the CEO indicated earlier, then it would be a little bit more. And when I did that analysis for Cayman in a previous lifetime, we were not trending in the right direction in terms of administration. And at the end of the day, it is still a hospital. It is there to provide care. And having a majority of people where 80% of your billing is around government, again, money that you're going to get anyway, or cynical or whatever, when you look at the majority, this is too much staff for intercompany or intergovernmental type transactions. So I would suggest you start looking at your head count and start looking at how you can best resources. Now, in this day of AI and automation and everything else, I'm not going to bring out the billing system because one of the biggest problems that we have at the HSA is a billing system. I mean, we brought in Cerner at the time. We were the guinea pig for an inpatient hospital when the majority of our patients are outpatients. And as far as I know, we have yet to get our billing system correct, and it is far too manual. But the truth of the fact is, in this day and age, we can't be throwing resources and costs that can be used, because I can tell you, at the end of the day, the public isn't worried about the size of the finance team. What the public is worried about is the waiting times of the HSA. And when you look at the amount of money being spent on administrative costs, because the systems are weak, when those should be spent on clinical issues, I think that's one of the things that's going to be coming down the line. So what I would suggest strongly is, as you go into your strategic review, start taking a look at lowering the administrative costs and start moving up the clinical costs, because at the end of the day, I can tell as a politician, I'm more worried about the health care as opposed to how quick the government get a billing or how quick the government get a paid or cynical, because government will write the check to another government department for government services. So just bear that in mind as you go through this exercise.
Through you, Mr. Chair, if I may respond to that. I thank you for that point, because the current business processes is that we still need to follow that same process to build government, whether it's core government or cynical. So those individuals are needed currently, but you're right, we can look at the business process and how those transactions are taking place, but I think that's a policy decision that we need to discuss with Minister.
Best standard, industrial standards. Like I said, the US was worse with 20% admin costs, and we were literally running 50-50 with admin costs. So if we're going to be world-class, and the DG is coming here later on, if you want to talk about having a world-class civil service or a world-class public service, then we need to have world-class standards. but we cannot have the HSA continue. And worse, when public health comes out, and public health was included in that, it is not going to look good from that standpoint. So people would prefer to see more resources being on the clinical side and taking care of people's side, as opposed to the administrative side, and that's just reality. And then some of that back office time and stuff can now move out of town, where it does not need to be taking up physical space at the hospital or physical space in Georgetown. That can be done out of town and just leave the healthcare where it needs to go. Because we also look at the amount of leases you have and everything else too. So there's a holistic view that needs to be done. And I guess the current speaker can feel vindicated, because why build a new hospital for 16 million when you can renovate the old one for 70 million and it can't go up nor it can't go out? So time has now tell that at least the current speaker was correct in his analysis from back in 1992.
Valid point.
Mr. Bryan, you have a lot more left to do. I'm just trying to get a view as to the timing. Okay, fair enough.
Thank you so much, Mr. Chairman. I want to go into the post-retirement healthcare obligations and the funding of these liabilities. As the CEO of the HSA, tell me, how do you feel about the strategy of your organization and the planning for that? Are you confident in the long-term sustainability of the organization for the liabilities that we are going to encounter?
Through you, Mr. Chair, yes, I do. I feel that our services, are efficient, but there are areas where efficiency can be enhanced in order to ensure the long-term sustainability.
What areas are those, and what are you doing to ensure that they're more efficient?
Those are the areas that I reviewed earlier in regards to making sure that we're costing appropriately. We're looking at our expenses to see if there's any areas that we can reduce those expenses. So I think those things need to be looked at in order to ensure sustainability.
Those will also help with your post-retirement obligations, because I think those were more focused on being able to handle your deficits or to reduce the possibility of deficits.
Through you, Mr. Chair, the post-retirement healthcare obligations, those obligations are for individuals who are with us that are on the defined benefit plan. Our board in 2010 made a decision that we were not going to provide those services to employees that came on after that date. So that means that that number is a reducing number as far as the individuals who are covered is concerned. But the cost of providing that past service liability does fluctuate based on the actuarial evaluations. Those individuals, are, I think the number's like 345 persons that are covered for the past service liability. That's a finite number. It's not growing. But I think, as a country, I think we need to look at that, because we do have Caymanians who have come on since 2010, who, will retire from the HSA one day, and they will not have the post-retirement healthcare benefit that some of us do, and persons in the civil service do. So that is a concern from an ethical and practical perspective, but from a financial perspective, it's very difficult for us to change that policy to include them in that pool, because you see the cost that is leveraged for that item every year.
So what I heard you say is that we're not prepared for the long-term liability.
No,
Not for
I
HSA.
don't. No,
I'm talking about your general
I don't. I wasn't saying that at all. What I'm saying is, we provide, our policy right now provides only post-retirement healthcare benefits for those individuals who were working with the HSA prior to 2010. A policy decision needs to be made in order to extend that to individuals who came on to work for us after that period of time as a country, because those individuals, when they retire, they won't have post-retirement healthcare benefits. So therefore, if they don't have the means to access care, they're going to go to DFA, and it's going to be a government responsibility anyway. But when you look at our financials, already the cost of providing that past service liability is huge. So to expand that group of individuals means expanding that cost, and that will further the deficit of the HSA.
Have you made recommendations to the minister or the ministry, past or present, in respect to this liability concern?
Through you, Mr. Chair, I haven't made any specific recommendation, but it has been in discussion so that they know that that is the current situation. But we've had that discussion at the board, but in order to expand that does have
Cost effects.
serious financial implications on our financials.
Well, here's my issue, Ms. Yearwood. My job as a member of PAC is accountability to sustainability. I hear you say you have discussions about it. What I'm not hearing is, what is your action plan to address it? So discussing it and no takeaway, no what are we going to do about it, whether it's your responsibility or the government's responsibility or the minister's responsibility, it sounds like you're just talking. Don't mean to be rude, but if you talk about it, you have a problem, and there's no action plan to address it, then you ain't doing anything about it. So again, has there been, you obviously have accepted the recognition of the problem, but you are the CEO of HSA, and you are the head person, the staff at HSA look to this liability, God forbid, for those who are really close to retirement now, because they're not getting an answer today. What is the plan to resolve that? If it's out of your control, then I think that, in my humble opinion, as the CEO, you say, listen, I've done everything within my power as a CEO to carry it up the ranks, whether that means I have to put forward a budget that is higher, but that's the government of the day and their policymakers. They're the ones that are elected to solve it. But are you saying you have not presented a plan to resolve it?
No, what I've said is that we've discussed it when we do our strategic planning meetings to say this is a gap. This is something that needs to be considered. I will bring it back again. But the cost of providing that service will have serious financial implications that then would need to be borne by the government. Because, as you know, HSA, according to the Public Authorities Law, moved over to the civil service pay scale. And there are a number of things that, make it equitable, but that is one thing. For our staff do not have post-retirement healthcare benefits if they joined us after 2010. So I will bring it back up, to your point, and we will, we'll determine what the direction will be in consultation with the minister.
Mr. Chairman, I will wrap up on that last topic. That's an issue that affects folks like SEMA as well, so it's a very important one. Moving on now, though, to audit adjustments, financial statement quality. Bit of a preamble to start. The auditors reported that the HSA's financial statements required 40 audit adjustments valued at $63 million after the audit commenced. The Auditor General informed us that this is higher than the average, which is 10 adjustments for other similar sized SAGCs, 10 adjustments that's valued at $8.7 million. Of the 40 adjustments, one adjustment resulted from the actuarial valuation in relation to the post-retirement obligation, which was valued at $36 million. The remaining 39 adjustments related to various areas affecting the financial statements. This represents the highest value of adjustments among all public bodies audited in 2024. In contrast, as the Auditor General informed us, the prior year audit of the HSA required 12 adjustments, totaling $81 million after the audit began. For the prior year, the adjustments to the actuarial valuation of the post-retirement obligation totaled $79 million. The current year adjustments worsened the HSA's operating deficit by approximately $7 million and reduced its net worth by approximately $33 million, significantly weakening its financial position. The magnitude and number of adjustments indicate fundamental weaknesses in the HSA's financial reporting processes. It goes on to say, further, we noted that the HSA's audit was not completed by the 30th of April 2025 statutory deadline. So, with that preamble, and given what the Auditor General noted with regard to the 40 audit adjustments, again valued at $63 million, and that this worsened the HSA's operating deficit by some $7 million, reduced its net worth by $33 million. I think I've heard you say before, but I'll ask the question, do you accept that the scale and magnitude and effect of these audit adjustments are significant and concerning?
Through Mr. Chair, yes, they are concerning, and we have a plan in order to address them. As you said, the past service liability was a large portion. I understand from the actuarials that it had something to do with the pool of individuals that was looked at, as opposed to, so they looked at the entire staffing pool as opposed to the individuals at hand, and that resulted in some of the adjustments. And then also we get that evaluation, often that evaluation comes in after the fact as well, so that that results in an adjustment. We also had the problem with the manual nature of our audit because of our accounting system not being finalized and working properly. So we had a number of system glitches. And then there were also some schedules that needed adjustment, and there were some differences in opinion with how that they were dealt with. One of them, for example, was the repairs and maintenance for the hospital for the rebranding. I think that was put in as a capital item as opposed to an expense. So it was the way that some of those schedules were completed, but you know the manual nature of this we are addressing during this audit by outsourcing some of the not outsourcing. We actually brought in resources to supplement our current team because of the manual nature, and then
Sorry to interrupt you, but some of your responses may be needed later on with a question I'm going to be asking. So okay. Maybe best just to hold those.
Okay.
And you are correct. The post-retirement, the adjustment for post-retirement actuarials, there was actually one adjustment for that. Mm-hmm. It was a significant number. It was $36 million. Mm-hmm. So that still left some 39 adjustments that were done for about $30 million in total. So the one adjustment with regards to the actuarial numbers may not be something you could have accounted for. It happened, but the other 39 and the dollar value and the impact then on the net worth of the HSA. Would you agree that these material audit adjustments would indicate a failure in the HSA's internal financial controls and pre-audit review process?
Through Mr. Chair, I think definitely it does represent that we need to do significant work in order to streamline our processes and to ensure that these schedules are prepared, and the automation of some of this is one of the areas that we're looking to help us going forward, because the manual nature of some of this work has led to some of these issues.
So that sounds like a yes. So the question, the next question I think you're about to answer, you're getting to answering is what specific control weaknesses allowed for errors of this scale to remain undetected until the audit stage? You're saying that a part of it was manual processes. Was there anything else?
Well, in looking at, just kind of summarizing the adjustments, I mean, some of it was a matter of interpretation. Some of it was, in the way that the accounting standards were applied. Some of it was, the way that we had costed some of the services. For example, staff costs. We have an escrow account that is held with the Health Practice Commission for, registration and that sort of thing. So the way that was costed was not in keeping with the recommendations, and therefore there was adjustment. There was quite a bit of adjustments in the inventory, and that piece is due to the manual nature of it. There was some that had to do with system glitches. So what I had started to say earlier was, in addition to us working with the another company that is helping us get through this audit period, simultaneously we're working with an IT company to help us, refine the inventory processes so that in coming years the manual aspect of it is not so heavy.
Thank you for that. You mentioned two things I'd like to get a better understanding of. Problem with inventory, you said system glitches. Let's start with system glitches. That sounds a bit easier. What system glitches were you referring to?
Mr. Chair, can I refer that question to the CFO? So I don't have that at the top of my head.
Through you, Mr. Chair. So, as the CEO indicated, we had just migrated from one system to the other. So there was data migration from an old system that was no longer supported.
This is the accounting system?
This is one of the subsidiary, the inventory system specifically, and also the accounting one. So in the past, we had two systems, one that was proprietary, that handled our inventory, and then we used the government IRIS system. We went ahead and bought a system that would do all the bits of the accounting function for us, including inventory. We migrated that data over from the old system to the new, but there were some configuration issues in terms of how those numbers translated from one system to the other. And because of that, the data was inaccurate, so we had to revert to go the old route, pen and paper. And you would appreciate that, for example, in our inventory, an inventory count could be 100 pages. In our pharmacy, for example, we have over 40,000 items, and the unit of measure in some instances were off, the prices got wrong. It was all an Excel nightmare, so we ended up with a lot of errors, moving between the various bits and pieces to try to get it in time for the audit. So we end up with material adjustments at that point.
Through Mr. Chair, thank you for that. That's actually rather astounding. I feel very badly you went through that. But who was responsible for choosing the new software and for implementing the solution, including moving from one older system to the new one? Who was in charge of doing that? Did you bring somebody in, or that in-house, or was that CIG?
Through you, Mr. Chair, we did it in-house. We had a steering committee, and it has been there for a number of years, maybe 2-3 years. The we relied heavily on external consultants who were primarily based in the East, in India. And there were I think there were lots of communication issues, as well as just understanding our business processes and getting it right. So I believe that's where we may have had some challenges, but it was managed primarily in-house.
I'll ask that. If I could ask, Mr. Chair, if I could ask, so a number of things come to mind, but the obvious one is has that problem been resolved now? Do you know how a working system that you're not back to pen and paper and Excel spreadsheets?
Through you, Mr. Chair, I'll take that one. No, the problem has not been resolved, but we're progressing. So we have an external consultant that's working with the team, and they have made progress. So whereas it's not going to impact the 2025 audit, it will impact the 26 audit, because hopefully it should be all implemented by then.
So the problems will persist into 2025, but hopefully be resolved for 2026.
Having said that, I don't know if I can say that our interim audit is in progress, is about to be finalized, and I believe that there's been, less issues during the time, at least that I'm aware of. May not be able to say that formally, but I feel that this audit has gone on a little bit better, the interim audit, because, we have had a number of other resources to supplement the team. So we want to ensure that by the time we do the audit in 2026, some of those systems are automated.
I have a friend who once said to me, with regards something that went wrong that I undertook, he said, "Roy, you shot yourself in the knee." Something like that, maybe what's happening. What lessons has been learned from this, or are still being learned? Because it seems like it's a major issue.
Some of the lessons, I mean, the team has discussed with me, is that oftentimes when you buy a solution off the shelf, it doesn't necessarily do everything that you want it to do, and you then have customizations. Sometimes those customizations create problems later on down the line. So we're working at making sure that, we anticipate all of these issues and we put in place exactly what we need right from the beginning so that the system works for us. Because, if it works for us, it's great, but if it doesn't, it causes more problems.
I won't go on that issue anymore. I'm hoping that by the time we get to next year, when we're back here at PSE, that we'll be hearing that issue has been resolved. Inventory, what was the issue with inventory?
That's the system that we refer to now, because the system was the bit that we had issues with in regards to how it produced the data for the inventory and the dollar, the currency. That's what I'm trying to look for. The currency in some cases was misconstrued as well.
Okay, well, so when you said earlier on there was two things, problems with inventory, you may not use the word problem, and then you said system glitch. So the two things are related. You mentioned that there were quite a number of the adjustments were inventory related. Is that because of, why is that? Why were the adjustments, rather than me putting words, why was the adjustments, you mentioned many of the adjustments were inventory related.
Mm-hmm. Through you, Mr. Chair, can CFO take that question? I mean, I think that she would be able to probably explain it better than I can.
That's fine. Thank you.
Mr. Chairman, sorry, just before we go much further, not intervening in the question, for our Hansards, please speak directly into the mic. Sometimes you speak out like this, you can hear the difference, and it's important that they hear it so they can record the details of what is being said. Thank you.
Thank you. Through you, Mr. Chair. Okay, so the worst part of our transition from the old to the new was our inventory. I don't think we got that right any at all, any bits of that. So we resorted to a manual process, a manual count, manually calculating, making sure the average price, we use an average costing, for example. And in some instances, those average costs weren't accurately calculated. Unit of measures from the count details, perhaps, and I'm just giving an example, should have been, say, a liter, but it went in as a case or some, because the items were small. However, in one system, the data from one system is in our functional currency, which is Cayman Islands dollar. Another is in US currency. And so it took a very detailed thing to make sure the units were right, prices were right, and then the calculations were all accurately reported, and the average prices rather than a list price was being used. So throughout that whole process, and because of the window in which we had to get it done between the count and the audit, that really took the wind out of our sails to get that right, because it's a huge undertaking.
So I'm here, through Mr. Speaker, so and thank you for that. So I'm hearing that the issue also includes possibly you knowing accurately what inventory you have on hand.
Through you, Mr. Speaker, I believe we had the count data right in terms of identifying the physical item and counting those. It's the calculation of the value to value it where we had issues, and then determining what was a slow moving, being able to project what we need to, the things that are indicate, pretty much that, write-offs and those elements, which in the past we would have had a system that would have just given us that quickly in a day or two, but now it took weeks to get that data together.
Thank you for that, through Mr. Chair. So you use the word I believe. So if someone at the hospital went now and looked at the inventory account for whatever aspirins, whatever it is, bandages, that's in your system. And it sounds like it's still a manual system you're using. Sorry, or did you say there's an automated system that has that?
No, our system. If you go to the hospital now, the data would be we can tell you the count, and it's in our system.
Okay, and if I go to just to keep it simple, if I go to the aspirins cabinet and I count the number of aspirins and number of bandages in the bandages cabinet, that will tally back with what's in your system. So there's no inventory control issues at the moment in terms of knowing that what's in your system is what's in your inventory stock.
We're closing those gaps for the most part.
So the gaps still exist?
There's in some areas where we still have gaps because we're not completely finalized resolving the issues around our inventory.
So
And
that's a
just
yes.
Sorry, through you, Mr. Chair, as I understand it as well, the system doesn't automatically degradate when you actually remove the aspirin from the system. That part is manual. You have to actually look at the utilization and then match that back to the manual count, right? That's part of the problem that we're working on now.
When did this actually begin in terms of the system change? When did the problem really manifest itself?
When the problem manifested itself in 2024, because we started migrated in 2023. So we, just for the last quarter, so I would say fully in 2024, we realized that we had significant challenges.
What time in 2024?
As early as January 2024.
So that's when the system change happened. The CRO system change may have happened at the end of 2023?
Through you, Mr. Chair, we migrated in the last quarter of 2023.
Thank you. And also through Mr. Chair. So January 2024, so we went through 2024 with the problem, went through 2025 with the problem, and we're in 2026 January, and the problem still exists. That is gone beyond a major concern. I feel badly saying that because I'm very fond of the HSA, but this needs fixing. This needs to parachute people in who understand what they're doing and to put something in place quicker clock. Right? This needs major surgery, to use that terminology. So what timeline have you put in place to getting this solved? And it really can't be December this year.
Through you, Mr. Chair, that progress is actually taking place right now, and we're hoping by the middle of the year that we will have significant improvements in that system. You know, what we had to do, I mean, we actually had to change consultants a couple of times as well in order to get people who were really, really understood what we needed. But the progress, we have actually seen some progress now, and we're very, very confident and hopeful that we will have the system that's going to be working for us instead of us working for the system.
Yeah, it's that word hopeful I'm hearing. That's still giving me a concern. I think my colleague wants to ask a question. I'll hold off. I don't have some others, but I'll come back to them.
Thank you, colleague, for giving way. I must say that I share your concern as well, because we're talking about medications, particularly in this space. Interestingly enough, just this past week, a constituent of mine had to go get medication for their child, waited almost 2 hours to then be told they didn't have the medication necessary that would normally be there. Is this deficiency, this problem, causing people not to be able to get the medication because you can't tell what your count is, because it has to do with your projections of having things available and so forth?
Through you, Mr. Chair, from time to time there's stock outages based on the global procurement challenges. So it's the issue in regards to a stock outage isn't because we don't have the inventory number. It's based on a procurement issue. Sometimes it's difficult for us to get them from certain companies. The company who we're contracted to get them from doesn't have the medication that we need, so we have to get it from somebody else. So it's a procurement issue. I don't know the specifics about that one case, but those are the things globally that I'm aware of.
Okay, I want to examine this for a minute, because when you say that it's a procurement issue where the supplier don't have it, do you not have backup suppliers? And the reason I'm going to give you the context to why. There's many Caymanians who depend on Cineco to cover them, and they can only go one place to get it. And affordability is a serious thing. So when HSA don't have it, it has to come out of their pocket, and they don't have the money for it. So HSA doesn't have the luxury, in my mind, to be out of medication. And supply chains can't be the excuse. Because you should have systems in place that have backup plans, and you're supposed to have systems in place that can predict and say, am I going to have enough supply for this time? Or if you are being told that you're not going to have this amount of supply based on your average consumption of it, that you can make your secondary plans to make sure that it's there. Because too often I see persons who are of low income who say HSA don't have it, so I now need money to help to go to the pharmacy and buy it, because you know Cineco is not being taken out of the pharmacies. So help me with that.
Through you, Mr. Chair, I would encourage you to confirm that that's the case before you give that individual monies to go buy it privately, because our stock outages have been very few in the recent months.
I can give you an example as close as 4 days ago. So I can happily bring the witness here this morning before we wrap up, if you like.
No, if you could tell me the name of the medication, I can check it out. But what I'm saying is we go through a procurement process for all of our drugs and supplies, and we have the primary company that has been given the agreement, and we do have others that we can get if they run out, and we're trying to strengthen that agreement as well, so that there's implications for that company if they agree to provide aspirin and they run out, that that they are responsible for assisting us to procure it from somewhere else. But we also work with the local providers if the medication is available locally. We work with the other pharmacies as well. So where there are challenges, we have ways that we have addressed it in the past, and we can do so in the future until we get the items in.
So what is told to a person who is using NAU insurance that there's no supply for a particular medication? What do you do normally?
Through you, Mr. Chair, the process is that they would procure it and then get reimbursement. But I appreciate the fact that sometimes they don't have the funds to be able to procure it up front, and that's when we are aware of that, that's when we will go and procure it from the local supplier in order for a small amount until we get our supply in.
So that means that there should be nobody being told that you don't have it. So I'm asking a practical situation. A person comes there, they say, listen, I need my diabetes or, child sickness or whatever, or we ran out. What does that person do? Do you go, hold on, let's run down to the pharmacy that we have a relationship with. You may have to wait another 3 hours because we have to procure it. But I'm telling you, people are being told you have to go buy it. But you're telling me something different. So I'm asking you, what is the procedure in that respect?
That is the procedure, through you, Mr. Chair. That is the procedure where the individual would purchase it and seek reimbursement from Cineco afterwards. But where there is a issue in regards to that person because they don't have the means to, they need to bring it to our attention so that we can then do something else in order to assist them.
Okay, all right. I know how to advise the public that if they are on Cineco and they cannot afford it because of whatever failings within the supply chain, the HSA will find a resolution, just bring it to the attention at the counter. Is that correct?
That's correct.
Thank you, colleague. Mr. Chair, just continuing. We were discussing the issues with regards to the numbers of adjustments and issues that created those because of glitches in your new system and issues around inventory. Do you have on hand the number of those adjustments that would be related to those two things, the number, the dollar value? If not, could you provide that to us? Because you started off, what made me ask about it was when you said was that quite a number of the adjustments were related to those issues. So I don't know if you have them exact numbers on hand. The total number of the adjustments and the total dollar value that covered.
Through you, Mr. Chair, let me just clarify, for inventory, you're asking for the dollar value related to inventory?
When earlier on you mentioned that quite a number of the adjustments, the 39 adjustments, ignoring the actuarial one, quite a number of the 39 adjustments related to issues with inventory and issues with the glitch in the system. So what I'm trying to gauge now is what that number is. Of the 39, how many of them were related to that? And if you have a dollar value for that as well.
Okay, according to the breakdown that I have here, is just under $10 million related to inventory in some sense. And then the other system glitches were $4.7 million. Part of the adjustment as well, a significant number, was bad debt. We had $8.5 million adjustment for bad debt. And then there were other adjustments that were smaller in nature, from $2 million and under.
Thank you for that. So $50 million of the roughly $30 million, again, ignoring the actuarial one, was related to those glitches. So half of them, is it that also half of the number of adjustments, was it also half of the number of adjustments, half of the 39 accounted for that at $50 million? How many of the adjustments, that figure of $50 million, what was the number of adjustments that accounted for that? If you have that.
I would need to provide that. I don't have that detailed breakdown. I would need to provide that.
But that was the bulk of it, you believe, apart from the bad debt?
From the dollar value, yes, sir. Through you, Mr. Chair, from the dollar value perspective, but I can't tell you how many adjustments make up that. 10 million.
What I was trying to figure out was are there any other issues other than,
Yeah.
are there any other major issues other than than what we've already discussed in terms of the system glitches and huge problems with inventory and so on?
Right.
Are there any other major issues that caused those adjustments? And anything else that we should know about?
The bad debt, I just mentioned that one. The bad debt was $8.5 million. And then
I'm guessing that's one adjustment? Through you, Mr. Chair.
I can't with any clarity say how many, but that's the dollar value. Do you have this? Okay, we can provide the number of adjustments based on the dollar value. I don't have the number of adjustments associated with the dollar value, but I can provide that detail.
Through Mr. Chair, and I'm not trying to be, I'm not trying to nitpick. What I'm really trying to suss out now is that is there any other major issues? 'Cause we weren't aware before about the inventory, the huge problems with inventory and the huge problems with the computer glitches and all of that.
Right.
In terms of the adjustments that were done, are there any other similar, and the bad debt, anything apart from those that are truly significant that we should be aware of?
I'm not aware of any. The other adjustments were smaller in dollar value, and I think it was just a matter of the treatment of those transactions. But those that we've mentioned account for the bulk of them, the adjustments, both dollar value as well as the number.
Thank you. And through Mr. Chair, can I assume then that I'll ask you, the audit delay, what was the major reasons for the audit being delayed?
The adjustments, and the manual nature of it. That was, we just couldn't get, through the amount of work during that period of time.
I thank you for that. And Mr. Chair, I thought that's what the answer would be. I won't ask the rest of my questions. I have other questions. I will leave that be. But I really would like to say that I understood that, I think you used the word hope, but that the problem would be solved by, was it the middle of this year? How sure are you about that? Because it is a major issue. And I know you're aware of it, but we're now hearing it to the public. So I need to make sure the public understands, that we understand, this committee understands exactly what the timeline is for it to be completed. And you mentioned that there's now a company or a consultant in helping you to resolve it. Mm-hmm. So when will it be resolved?
I can't go on record to give you an exact date, but all I can tell you is that it is a priority of ours, and it's something that the team is working on a daily basis now for the last number of months. So I can go back to the team and get a date. I can't go on record and say that just from the top of my head right now.
I'll end it with this, and I'll turn it over to my colleague. Through Mr. Chair, I'll say that I would have, again, the problems began at the end of 2023. Really understood what was happening in January 2024. We finished 2024. We finished 2025. We went to January 2026.
Fair point.
It's been going on for a long time, and really, by now I would have thought that there would have been something more concrete that we'd be hearing in terms of here's what's happening, and this is what's been done, and the goal is to have it fixed and resolved by X date. I'm not hearing that. As you just said, you can't give that. So there's nothing else I could ask of that, but thank you very much for your testimony. It's an unfortunate thing, but as you just said, it's a serious thing, so I hope it gets sorted out soon. Thank you very much, ma'am.
Thank you too, sir, and through you, Mr. Chair. It may be unfair to my team for me not to be prepared to give that date. So I undertake to go back to them. I just didn't come prepared to give that date right now, but I will undertake to go back to them to get the timeline. All I know that it will be, within the next couple of quarters.
Thank you for that.
Mm-hmm.
Through you, Mr. Chairman, Madam CEO, I'm quite sure this committee is prepared to give you a couple of minutes to send a message with technology the way it is today. This is a serious issue.
Okay.
We need an answer today because with already 2 years in and then saying in the middle of this year is another 6 months, I don't think that the appetite here is understanding why this issue is continuing to be a problem. So, and besides, when you procure outside parties to do a job, it has to have some sort of timelines within that procurement of assistance. Which brings up my other question is, what outside entity did you say was helping with the financials? Because I can't seem to find anywhere in the reports which entity this was that was helping us with our books. Can you say?
The entity was appointed following the procurement process, yes, and it's E&Y that's working with us to do the inventory. They're helping us with the manual nature of that inventory aspect.
Okay, so they're the ones that are doing with the inventory as well as the accounting?
Can you do it?
Through you, Mr. Chair. We engaged them to assist us with the inventory because, as we said, it's very laborious and we didn't have the resources to just dedicate to that fully and ensure that it came out to the standard that we required. And also our receivables, which is also another huge undertaking. So they're helping us with both elements.
So can we get a data conclusion on both of those elements? Because let me just make sure I got this right. They're helping with your accounting backlogs or support systems to make sure that they're operational from your accounting practices and billing. I think that's what it was.
Through you, Mr. Chair. No, they're assisting us to ensure that we are ready for audit so we can produce proper valuation reports on our inventory and help us to clean up our receivables, which has also been a very has been a challenge for us as well. That's also manual, so they're also helping us with those two. Those are the two biggest ones that we needed help with.
Okay, well, with that being said, because I'm mindful that we got about 19 minutes left.
No. We don't got 19 minutes left. I got my time to talk. But there's non-PPM members here.
I do apologize to my colleague. I think I may.
No. You don't need to apologize for me. I've sat down and I've listened to you guys. So I'm not asking questions. I got my questions too. I represent people too.
Through you, Mr. Chairman, I want to see if I could ask a question in respect to the. Actually, I'll give way to my colleague and I'll wait till he's finished. I'll ask my questions.
Thank you very much, Mr. Chairman. Through you, Mr. Chairman, to the CEO or CFO, can you tell me exactly how much money is spent on training each year at the HSA? What's the training budget like and what is actually spent?
We generally, through you, Mr. Chair, we generally budget between 300 to $500,000 per year. The average spend that I've looked at over the year is just about 300,000.
Okay. The reason I ask that question is I'm listening to the different issues that you have in finance, from inventory, there's bank reconciliation, and there are other issues. You have 37 members at your disposal. And the question I'm asking is, how many is actually spent on cross-training your team to basically handle these issues? Because I think at the end of the day, you have resources. The question is, how do you allocate the resources? And the question is, because I know some of the members that you have on the PFS team are very capable people. And I think they can be cross-trained or up-trained in some cases to actually do more. Because you used a term a while ago, there are two terms that are being batted around here that are giving me pause, and that is those external consultants. And in a previous PSC, we went through an issue dealing with all the money that government is spending on external consultants. And the problem with that is when these external consultants comes in, they fix the problem, they leave with the knowledge of the problem, and then leave with the knowledge of the solution. And ultimately, I would prefer if we even take our chances with our own people, invest in them, and at least they learn to solve these problems, the knowledge stays within the HSA. But every time you use these outside consultants coming in and coming out, when you have people sitting there that, and I know some of them because I know the CEO, know I reached out to her on a different issue of people who want to do more, who's capable of doing more, but we need to make that kind of investment. And that is the point I'm trying to get at, is how are you deploying the 37 team, bearing in mind that Accountant General is sitting there. Matthew, sorry, how many people you got working in Treasury?
Mr. Chairman, through you, about 45 people.
Okay, so 45 people to run the entire government of over $1 billion and 37 to run SAGC. You see where I'm getting with this? Mm-hmm. It is how you use your resources. I do not like the use of consultants. And as I'm sitting there listening to inventory issues, the first thing that came to me that alarms was end-user computing issues in terms of inventories. In a day and age when just about every single thing you have a barcode. You know what I mean? So we have inventory accountants, we have cost accountants, we have different type of accountants, we have bank reconciliation accountants. The question is, taking the money that you have, invest that with your 37 members on your team before you're talking about even adding anybody else at this point. Train them and deploy them as you need across the HSA is the point I'm trying to get at.
Through you, Mr. Chair, you're absolutely right. Training our local Caymanians is one of the priorities for the HSA. We've had lots of in-house training. We've actually brought in trainer in order to train trainers, in order to upskill our staff in clinical areas as well as other areas, as including finance. However, I think that this issue, the manual nature of this issue, is more than just a training solution. It's really the workload level. So I appreciate your point about consultants, but the only reason why we brought in these consultants was for a specific task to give us time to recruit our own Caymanians to be able to help us do this going forward. And just going back on the point that you made about barcoding. Barcoding is one of the things that we're implementing in this inventory fix that we're doing. And I'm being told that the project should be completed by the end of the year, but there's going to be milestones for things like barcoding and lot tracking and whatever. So, you know, we definitely take your point in regards to upskilling our staff. Where we can do that better, we will continue to look for opportunities.
What was the decision made to change the inventory system? What was the underlying problem with the previous inventory system?
We had a previous inventory system that was built in-house, and it had legacy challenges, and it was no longer supported because the individual that built in-house left the organization and it wasn't supported. So that's the reason why. And there were issues. You know, we had outgrown that inventory solution.
Madam CEO, I was on the board when they went with the Cerner system. Oh, no. And they replaced a system that was built by an individual that was in-house. I think, if memory serves me right, I think it was Mr. Ellis was his name. And I remember the then chair of the HSA telling the minister, you should have taken that new system, put it back in a box and put it on a shelf because it was not going to work for what we wanted at the HSA at the time. History has proven that he was correct at the time of his analysis. We brought in a certain system that was designed for an inpatient hospital when we were primarily an outpatient hospital. Completely mismatched. And ever since then, the billing and everything has been gone sideways. And every single time we change these systems, it has been a growing pain that costs significant amount of resources. And the point I am making in all of this goes back again, and I'm going to tell you as an accountant, a lot of this stuff is not overly complicated in the sense, especially on the inventory side. And the point I'm making is make the investment, because we have gone through this issue of consultants here already, and I can tell you many times, we have listened to consultants, and we have gotten whatever on the other side of it, and we have not received value for money. You know what I mean? Here we are, we went out, we have spent all of this money on an inventory system, and I am almost certain that if you go back and you ask the OAG people, they would have told you they were better off leaving the current system that we had, regardless of its limitations, compared to the mess that we have right now. Because at the end of the day, looking at your balance sheet, your inventory is almost $20 million a year that you're sitting on, so it's not a small amount of money. And that's just the balance in the account. That doesn't basically signify the usage throughout the years. That's just what is sitting there. And you can't have a system where $20 million worth of supplies is sitting there and we have no idea basically what it is or whatever, or the value of it. You know what I mean? So, and this goes back to my point, if you're going to go through the growing pains and the teething problems, do it to your people. Make an investment. I would prefer you come here and say, you know what, we tried this with our people, it's not quite where we want it yet, but we're getting it fixed. At least the knowledge remains. Whoever you're working with, once it's fixed, that knowledge is gone. Okay? No. So I don't want to get into that, but I just want to say to you, that's just my opinion on that issue. Now, the other issue I want to touch on was CERNA itself. Now, an error does not become a mistake until you fail to correct it. We made that error more than 20 years ago. The question is this now. Are we at a point now for the HSA, bearing in mind that the HSA is now twice what it was when CERNA came in, and we're a bigger outpatient hospital than we were now. The question is this, is the CERNA system now adequate or can work to meet the needs of the HSA at this point? That's my question.
Through you, Mr. Chair, I'll just go back and just make a comment on one of the other points that you made in regards to training in-house. So one of the responsibilities that the consultant has now that is helping us with the implementation is to train the staff that are going to be using the system afterwards. So that is the materials management and the IT staff that are working with the system. And indeed, I think OAG will support me on here if my recollection is correct. We had an audit point that the prior system didn't meet our needs at the time. And that's the reason why we were looking to, engage, to change it.
Well, clearly the new system didn't meet it either.
Going back, I can't argue with you right now, because yes, the proof is in the pudding, right? But we are working with the team in order to improve on that. And you made the point about Cerner. Cerner is a good system. It's like you said, it was an inpatient system. It's a clinical solution because we use it for inpatient, we use it for outpatients. It's excellent from a clinical perspective, but it's a back-end business functions that we have a problem with. So that's why we're looking to interface these other solutions so that it will supplement the clinical component of it. Having said that, though, from time to time, we go back out to tender to see whether or not there's anything better out there than Cerner in order to meet the cumulative needs for us. So that's something that we will continue to look at.
The next thing I want to touch on, because this is all integrated, the coding itself. Because I remember there was a separate exercise that's been done on the coding. And one of the issues that the insurance companies had raised was the actual coding that was basically going on in the bill. So the question is, even before it gets to your billers, because remember there was an issue with the clinical staff actually using the correct codes. The question is now, have that been sorted out? Because one of the issues I remember from your PFS team was, and again, I'm going back my memory, you probably know this better than me, when we started out with this issue, was the actual coding. Have we gotten the coding correct yet? Because a lot of effort a lot of time has been spent on correcting a lot of codes, if my memory serves me right.
Through you, Mr. Chair, the coding is linked to the charge master. So every year, AMA is a US-based company updates those codes Those are our procedure codes. And we haven't been keeping up to date with those because we haven't had the updates in our charge master on a regular basis. But for the most part, the codes are in date. And the clinicians are dropping those codes and being supported by the support team who does the coding as well.
How many people are on the coding team?
I think there, off the top of my head, is probably 6 to 8, but I would
I mean,
need
like
to
68, that's in
confirm.
like 7, on average, like 7, right?
Yeah.
And the coding team reports to which manager, which area of the hospital deals with the coding?
Health information management and IT. They share that responsibility.
Okay, so in terms of the actual update, it says that's not being done regularly because I'm assuming insurance companies that you guys are sending these bills to, if they are updating their system on a regular basis, and I'm certain that they don't have the amount of staff that you do, question is, what is it that they're doing differently that they can recognize when the coding, that there's an issue with coding that we aren't doing? What do you suspect that major issue is?
It's really the approval process because they're linked to the procedures. They're linked to the charge master. So we need to have the approval to update them on an annual basis.
So you need approval from who?
When we go through the whole cabinet process, I mean, if there's not a fee change, then I guess we can update them. But right now it's linked to that charge master update process, which is what we are in discussion with the minister about to see if we can separate that. So it's an automatic update. It has nothing to do with the cost of the fees. So we're trying to disengage those two processes. So the automatic update of the fees is just something that the industry does every year, and it has nothing to do with the charge master update.
Sorry, you've got my attention with something. To change the code, if you just said, requires cabinet approval?
Because it's linked to the charge master update.
Yeah, but we're not changing the fee, we're just changing the actual code for the service.
Yeah, but sometimes it does have a knock-on impact on the fees because one procedure code today may be 2 procedure codes because it becomes more refined in 2 years' time, right? So that's the reason why then it has some link to the cost of providing the service. But I take your point, and it is something that we are looking to see if we can disengage those two things.
Okay, I just want to close on one thing because I think my other colleague is back and she probably wants to have a few questions. But I just want to go back on the post-retirement healthcare liability. And I want to read something here from the latest planning estimate from the budget process. And this relates to the Cayman Islands Government as a whole. And under the subject of post-retirement healthcare liability, it reads, the government acknowledges its obligation for the future healthcare costs of civil servants, including their dependents. The Public Service Management Act requires civil servants to have a minimum of 10 years qualifying service with the core government and also retire from the civil service in order to be entitled to a healthcare benefit upon retirement. The results of the actual healthcare evaluation completed in May 2025 estimated the post-retirement healthcare obligation is as at 31st of December 2024 to be $2.3 billion. $2.3 billion. The post-retirement healthcare obligation and any related expenditure have not been recognized on the statements of financial position and performance for core government. The government is operating on a pay-as-you-go plan with respect to post-retirement healthcare liabilities. Currently, no long-term assets are set aside in respect of government's post-retirement healthcare liability. I chose to read that for a reason because the earlier question was asked in terms of what you're going to do to address your $221 million problem. And the real elephant in the room is the overall government $2.3 billion problem. And I know, so I think it's a little bit unfair to some extent, and I just want to put that out there because this is a problem across the entire public sector. And Mr. Chairman, I raise this issue again because for this year, I'm going to be focusing on government in terms of getting back to that defined benefit pension plan, do away from this contribution plan that we all know isn't working, because at some point we need to start recognizing we have an aging population. You look at the average age of people within the public service is already in their 40s, And the last analysis we did, we have around 14,000 Caymanians that be hitting 65 in the next 12 or so years. And we can't wait till then to start addressing these issues. And we know it's coming where it's going to be a lot of inadequate pension, cost of living, inflation, and currency debasements have been killing our people in terms of when they go to retire, we're kicking the can down the road. So this is not just something for the HSA to deal with. This is something for all of us to deal with from that standpoint. And it's really unfair that even people who have joined the HSA post-2010 literally do not have some of these benefits. So this is something that needs to, so I know you were asked about it. I think maybe the only SAGC, I think of memory, that has dealt with this in their financials, I think maybe Port Authority. I think where they have actually recognized here. So this is a problem across government as a whole. So I don't want it to look as if though, or leave it out there that the HSA is doing something or having your staff freak out, wondering what's going to happen to us when we retire. This is something across the entire government. But I know Ms. Julie is back and she has a few questions, so I will yield at this time.
I would just make one statement before we go forward and allow Ms. Julie to ask her questions. But I think your points are well taken and they're all really relevant. I think perhaps we might want to discuss that with the Deputy Governor this afternoon when he's here to give his testimony. So I think it'd be a good idea to raise it there. Sure. Ms. Julie.
Thank you, Mr. Chairman, and glad to have Ms. Yearwood and Ms. Thomas. Thank you so much for coming to explain to us some of the questions that we're having as a PSC. Now, let's deal a little bit with the ISA 260 report. The 2024 audit of HSA identified significant control deficiencies and operational weaknesses in the financial management system. These findings reveal systemic issues in various areas, including the bank reconciliation processes, which is what I'm going to mostly deal with right now. Inventory accuracy and completeness, and revenue transaction integrity and compliance with established financial controls and acts and regulations. We would thus want to focus on the inventory and bank reconciliation related issues. As mentioned earlier, the HSA recorded $63.9 million in audit adjustments, indicating material differences between the recorded and the actual financial positions. Of these, $2.6 million represented 110 entries that were to resolve bank reconciliation issues. So we know that that is major if we had to make that many new entries. Okay, so first of all, let me ask, what is the bank reconciliation process and controls that you have in place to prevent unposted transactions from remaining unrecorded? How is that dealt with, and how do you get to a place where there's that many transactions that you have to go back and redo?
Through you, Mr. Chair. So thank you for the question. The bank reconciliation process, even now, has always been a manual process for the HSA. Back in 2024, when we attempted to do the first couple recons, and then when the issues with the systems started going, we kept rolling back our bank reconciliations because the numbers just were not adding up. So each time when we thought we were getting to a good place, we had to roll back. So we did the reconciliations multiple times in 2024 because we could not get the reasonableness and the satisfaction we had around them. At year end, unfortunately, we did not get to post all those entries from the months of reconciliation in time before the audit. So they were left unposted after the submission.
So would you say then that that was because you're saying you didn't get to post them or you didn't have time? Is that a staffing issue? That you needed more staff to help you post those transactions? Or I mean, because you know the audit is coming up, you know end of year, you know all of that. So all that is known. So you know that there's a certain time frame to get all this work done. So in my mind, then shouldn't we have taken some prior steps to make sure that this was done in time?
In retrospect, we should have taken the steps to ensure they were posted prior to the audit, but they were actually done and reviewed multiple times. So we were satisfied that while they weren't posted or there was nothing untoward happening, it's just that our numbers were not in our system. But yes, in retrospect, we should have been posting them, the adjustments.
Okay, so what have you done so far or since then to correct that issue and going forward? I mean, have you had enough time in between then and now that you have now not only corrected it, but you've seen a good working balance, and is it working properly now is what I'm trying to get at.
Through you, Mr. Chair, since 2024, we have engaged more experienced staff, permanent staff, no, not consultants, and our bank reconciliations are up to date, and they are posted in the system. Yep.
Okay, so they're up to date and posted now.
Yes, ma'am.
Okay. So we don't expect that to happen next year when the audit report is done. That's going to be a different picture next year then.
It should be.
Oh, okay. Okay. I know we dealt a bit on the basic inventory controls and having them standardized, but I still have a question in my mind regarding the different locations and how is it standardized across the different locations, or do you have one system that you use at the HSA main pharmacy and another system at, say, the West Bay pharmacy, or all that is standardized so that you could tell what you have at any particular location, or they would have to call maybe the main HSA to find out, is there more medication available, or can they look in the system and see?
Through you, Mr. Chair, we have a standardized system. So the same system we use throughout our entity, including the sister islands.
Okay, so that's standardized. And that's all for now for me. Thank you for your answers.
Thank you. Mr. Chair, I just need to correct something that I said earlier in regards to the number of coders. I believe I said 9, but there are actually 14. My team has just corrected me, it's 14. And just to clarify as well, in regards to the coding, because there's diagnosis coding and there's procedure coding, and the coders that we're referring to, those 14, they do the diagnosis coding, and the procedure coding is done by the clinicians, the physicians.
Okay.
Yeah. And if I may, Mr. Chair, can I just, for the record, just update the public and update the House in regards to something that was said yesterday by the Deputy Chief Officer. I think she wrote to Parliament to correct the statement, but I just want to put it on record that financial statements are provided every month. And there is so it goes to the board in the CEO's operational report that all of the senior managers assist me to put together, and they work with their managers to put together. So there's a full set of financials that go to the board every single month, and there is a representative from the ministry that sits on the board that gets a copy of that report. I accept that it's quite a lengthy report. It can be like, 60, 70 pages, so it may not be all perused before the meetings, and then it's also sent on to the ministry. So I just wanted to put that on record, and I believe the Deputy Chief Officer has also sent an email to that extent to Parliament to have that corrected.
I appreciate you saying that and making that clarification. I confirm she did write to us. And I have actually have a copy of the email that she sent, but her testimony must stand as it is.
Yes,
I think you appreciate that. So this does help to provide that clarity as well.
And Mr. Chairman, I crave your indulgence. I just had one more, not a question, but just an observation, listening to one of my other colleagues, their questioning, and I know Ms. Yearwood said that when they're out of medication, you know, there is a process in place where they can come to them or let them know that they do not have money to go to another pharmacy and purchase that. Just for the record, I want to say that there, as you well know, that there are many, many cases where persons in our community cannot afford to go to other pharmacies, and they depend heavily on that medication. So I would just, and I just want to say, that process is really not firmly in place. Much to my dismay, and even though you might want to say it's in place, I can tell you categorically it's not in place, because your pharmacist does not say to people when they come there and they say, I don't have the money. For one, it's very embarrassing. So you're not going to have that dialogue with a person coming to say, you know, I need my medication, and then your pharmacist will say, I'm sorry, we're out of that medication. Yeah. That it stops there. They do not say, we have a consultant that you can speak to. Let me call them, and we can see how best we can help you. Nothing like that is said at the counter. So perhaps I would just implore you that if we can at all get something in place where it's not embarrassing, number one, for the customer or for the our people who are HSA customers and clients, and number two, where it is a known fact that if you're out of medication, there is some way to let them know in a nice way that there is a workaround. We can get this for you. We might not be able to get this for you within the next hour, but by the end of the day, we're going to see if healthcare pharmacy can supply that for us, and we will have that for you. Or what would be even better, if there was some system in place where that you could just send that customer then to healthcare pharmacy and pick up their medication, and then HSA picks up that tab. That would make it even much better. But I just want to implore you that that is very important, and it is causing, I know why my colleague brought it, because we get a lot of those complaints from our constituents. So on their behalf today, I'm just imploring you to get that better regulated. Thank you very much.
Through you, Mr. Chair, that point is well taken. I know that, you know, you have the ears of the patients, and we want to make sure that there's good outcomes to their care, because they may walk away because they're embarrassed to say that they don't have the money, and then they not take their medication. So I will undertake to speak with my team to see if we can somehow, you know, put some business process in place in order to address that. Thank you.
Before we actually take the lunch break and bring this whole thing there now to
Mr. Chair, sorry, just one quick question before you.
And I got a question for.
Oh, I'm sorry. I'll let you go.
Give it to you back.
I thought you were closing it down. I'll wait till after you finish.
I just really keen to hear from you, Auditor General. You know, in talk all the issues and difficulties, the challenges they had. How did that impact your team in terms of the audit, the time and effort that was put into the audit?
Thank you, Mr. Chairman. I think as mentioned before and also discussed within the report, there were significant delays in the time for the audit because there were significant adjustments that had to be made during the course of the process. I know the CEO mentioned that we have started the interim audit for 2025, and to date, potentially, we haven't seen the same issues, but it's important to note that the issues that we're seeing in 2024 were on the financial position statements, i.e. the balance sheet, which we haven't started to look at as yet. That's going to be done basically in February, March, April period. So we haven't really been able to assess as yet whether or not issues will occur again for 2025. But based on the comments today, we're hopeful that there'll be improvements, but potentially we might see again that there's going to be a further delay in the timing of the audit being completed for 2025 because of the same issues rolling forward from 2024 into 2025.
Just for my own edification, when did you actually sign off on the 2024 audit? I didn't see that information here.
Mr. Chairman, it was signed off on the 21st of July.
Okay, thanks.
So approximately around 3 months after the statutory deadline. Yeah.
Okay. Just curious, do we have more questions for the CEO and the CFO. Okay, I'm going to actually give way to Mr. Tatum first, and then you.
Thank you, Mr. Chair. Mine won't be long. It's a yes or no. You'd indicated that you would, I think you'd indicated earlier on that you were going to get the timeline with regards to when the systems issues would be resolved. I know you had some feedback. I'm seeing if your team has gotten back to you on that.
Through you, Mr. Chair. Yes, the process will be fully implemented by the end of the year, but in Q1, the barcoding project will be done. Q2, the lot tracking and barcode count with valuation, and Q3 would be the interface. So the full project will be completed by the end of the year.
I thank Ms. Year for that, and if I could just ask just one thing, if you could send that information to the committee, also the name of the company that's helping you resolve this, to provide the solution. Thanks.
Through you, Mr. Chair, yes, I will.
Thank you very much, Mr. Chairman. Mr. Chairman, I just want to close on one last bit of housekeeping for me. And I already spoke to the minister about this, as I mentioned yesterday, I like the path that she's going on, but just to close something out from the public standpoint for me. There was a recent article in the Cayman Compass with the headline, Internal Inquiry Recommends HSA Board Pay Back Some Funds. And part of the article goes on to say, previous Compass reporting showed the lay board made up of 6 to 8 members met 190 times in 18 months to June 2025, collectively claiming almost $500,000 in stipends. And the report also spoke about the lack of minutes for those meetings. Now, as I went through the HSA's annual report, I couldn't help but notice that, and I made my own notes here, that in 2022, well, let me go back a little bit. In 2020, the total HSA board fees was $82,215. In 2021, it was $192,550. Now, that didn't really jump out to me because back in 2020, when they made when it cost $82,215, the HSA had a profit of $1.2 million. And then in 2021, even though it was $192,550, the HSA had a profit of over $8 million. But then in 2022, Mr. Chairman, it went up to $250,900. In 2023, $250,750. And in 2024, $326,700. And throughout those years, the HSA had a cumulative loss of roughly $24.7 million. So in short, Mr. Chairman, in those 3 years, the HSA paid out board compensation of $828,350. That is a significant amount of money and the largest of all the government SAGCs. Now, I know at the end of the day, the CEO reports to the board, but nonetheless, these are still public monies. And what I would like is a detailed breakdown of that $828,250 of exactly who got what, when, and for why. Because I understand from reading different stuff, that even include costs for people showing up to cut ribbons and people standing behind a person cutting ribbons, charging $500 for that. I understand it include costs of you having your staff meetings and people coming to your staff meeting, watching you have your staff meeting and charging $500 for that. Now, this is something ultimately that is above your pay grade, and we're glad we're closing off for the Deputy Governor, who under the law does have some responsibility and oversight. And to give the DG his credit, he did send the internal audit in to look at it, and they've done their job. But the reason why I raise this issue is that there are reports in government where people are required to pay back money, and some of those reports ended up with people being incarcerated at an institution in my constituency. But that is something that we deal with. But for right now, what I would like is for this committee to be provided with exactly who got that 828,000, broken down by month, and for what meetings it was for. But this is still a public funds, and that's a significant amount of money to be spent in 3 years for an institution that met way too many times. And as we saw from yesterday, and Bobette, the acting chief officer, have confirmed, of the 330 meetings that they had, the ministry only attended 33 of those meetings. And the law does have the ministry representative as a member of the board and whatever needs to be done. So we need to understand where those public funds went and who abused the system. And then we'll take it from there. Thank you very much, Mr. Chairman.
All right, 115 or 120,
Mr. Chairman, trust me, I definitely want to wrap up now myself, but
well, we have the deputy governor coming at 2 o'clock, and we got to do lunch in between. So can you make it quick?
I hope that this will be no more than 2 questions, potentially even 1. I am forced to ask a question about a report. Thank you so much, Mr. Chair. I am forced to ask about a question that is tied off of what my colleague just asked in respect to the board remunerations. And not to get into what he suggested, I think the details would be sufficient for us to understand what's going on. But the Attorney General's, Auditor General's office did write to you and ask about observations that they saw about these spendings and the amount of meetings in 2021, 2022, 2023, and highlighted the risk of and implications of these and offered some recommendations. Recommendations were that their too frequent meetings may cause the board to lose sight of its strategic issues, leading to an emphasis on operations and lack of segregation of duties between the board and the management. And they offered a recommendation, which was board meetings should be held with sufficient frequency to discharge the duties effectively, but not so often that the board may lose sight of strategic issues. Now, naturally, you responded, and to summarize, it basically gave highlights to the PAA and the Health Services Authority, basically saying that they don't agree. They basically disagree with the recommendations. Now, I think you're the one obligated to respond on behalf of the entity. I just want to make sure that this is, whose view is this? Is it yours or is it the board? Because obviously, naturally, this is a recommendation and a risk analysis of the board, just so it doesn't fall on the wrong lap.
Through Mr. Chair, that response was made in consultation with the board. However, since that time, the minister has changed the compensation structure. So that whole, that whole element is being revisited in regards to the frequency of meetings as well. And no doubt there will be changes at that level.
Thank you. Is it fair to say then that the recommendations made by the AG's office is now being accepted and the changes would reflect those?
Through you, Mr. Chair, I would expect that they would be incorporated, but recognizing that the frequency of board meetings is outside of the CEO's jurisdiction.
Correct. I'm fully aware of that. All I'm basically saying is that you had a board that disagreed that they shouldn't be meeting so much, and they had the authority to do so. And I suspect, based on the changes I see now made by the minister, that they're in agreement with the previous board, hence the reason for the changes that they're obligated to have at least one, and they will be paid for the ones that are registered, not the other ones, as we will. I think there's an internal report being done that is not being completed as yet, which I'm certain everybody would like to see what the outcome of that is. But I just didn't want to make sure that it didn't fall on your viewpoint, but it was based on consultation with the board to have that response to the Auditor General. Is that correct?
That was in consultation with the board, correct?
1 second, Mr. Chair. Just the housekeeping, how soon do you think you will have those breakdowns available for the committee that my colleague asked for earlier?
I think we could get that by end of next week. Give us 1 week. I mean, the information's there, maybe sooner, but just I don't want to overpromise and underdeliver. I prefer to do it the other way around. Give us 1 week, please.
And lastly,
is that fair? I mean, is that acceptable? Because I'm sure we can do it sooner, but yeah, Tuesday? My CFO is undertaken for Tuesday. So
all right, so we have a commitment for Tuesday, providing the report that I think we're all aware of that's currently happening in respect to this space of board remuneration. Are you aware of any time that will be completed, or is it in your viewpoint at all?
The project has just been kicked off. They have requested preliminary documents to review, and I believe there's going to be a period of interviews that would take place after that. I think the report turnaround time is quite short, but I can't speak specifically to it because it's the ministry that has commissioned that report.
Gotcha.
But I believe that it is a quick turnaround.
Okay, I would hate to have to call back the ministry, so if you may, I know you see your
I can get you that date as well. I can.
Yes, that would be great.
If you would like that, yeah.
Thank you, Mr. Chairman.
A marathon session. But this concludes the testimony for the Ministry for the Health Services Authority. So Ms. Lizette and Ms. Thomas. Sorry, it is Friday. It is lunchtime. My apologies, but I want to thank you both for your attendance here at this hearing today, and thank you too for the testimony that you have provided to the committee. I appreciated what I perceived to be the candidness and the transparency with which you answered all the questions, and I'm grateful for what you have done and for the information you have given to the committee. So we will go ahead and we'll excuse you at this time. But the rest of the committee, it's 25 after 1. I've scheduled the Deputy Governor to be here at 2 o'clock to take his testimony. So we basically have got 35 minutes to have lunch and get back into the chambers here. So let's be back here by 2 o'clock on time, please. Thank you, everyone.
Thank you, sir. Thanks, everyone.
Could I ask all Well, thank you all for returning to the chamber. Basically, we're all on time. So we're down to the wire now and with our final witness this afternoon, so we're on a home stretch. So at this time, I believe the Deputy Governor is out front. I would ask you to show him into the chamber.
Comms, Department of Comms, yeah, so they know when to start.
Good afternoon, Deputy Governor.
Good afternoon, Mr. Chairman and members of the PAC. Happy New Year to you all.
Happy New Year to you too, sir. We're glad to have you here and to see you. Yes, I know it's a busy time of the year for you, and I think you may be counting down your days too.
Yes, sir. I was thinking, talking to my team coming over here, that this could be my last PAC. I don't know.
Possible.
So let's
Very
see.
possible.
Yeah, which would...
I hope not, but...
Yes.
But anyway, Deputy Governor, welcome to the committee. We have been discussing for the last 2 days the Auditor General's report, financial reporting of the Cayman Islands Government, general report on the results of the 2024 financial audits for year ending 31st of December 24. So you are the last witness for the hearing, and based on the material that we have with you, we hope we won't be here for very long with you on this.
Yes, sir.
And that we'll get through, not too long from it, maybe an hour, hour and a half at the most.
Yes,
so before I actually lead off the questioning with you, just read a bit of a sort of set the stage. Whoops, you did, and my apologies. I give way to you now, Mr. Saunders. You did ask if you could make a very short statement.
Thank you, Mr. Chairman. Honorable Deputy Governor, yes, sir. I just want to once again publicly thank you. Yesterday, I reached out to you with an issue that a young Caymanian family was having in terms of naturalization and getting things moving, and your prompt professional response. I mean, this is not the first time. The other one, I think that had made news headlines, but I just want to publicly, on the record, thank you for being responsive and sending the tone to whoever the next DG may be, that this is kind of what is expected. So the family was a little bit relieved in terms of the speed in which you dealt with it, and I just want to publicly thank you. And these weren't even constituents of mine. These are actually people from West Bay. Yes, but they reached out to a mutual friend, and we got everything sorted. So I just want to publicly thank you for always being that prompt professional response. So I just want to set that for the record. Thank you.
Mr. Chairman, through you, sir, thank you very much. It's a real privilege to be a civil servant. We have this amazing opportunity, Mr. Speaker, to make people's lives better. And when we can come together, as we did yesterday, to help a family in a serious situation, that's one of the benefits of being a civil servant, is that we can make decisions that truly affect people's lives in a very positive way. So thank you.
And the satisfaction you get from being able to do that cannot be measured.
Exactly, sir.
You don't need to look at that.
Just want to make sure, sir. Yeah.
Yeah, absolutely. The only thing I would say, Deputy Governor, if any of your people are actually going to give testimony, that we would swear them in.
No, Mr. Chairman. I really have Mr. Kristen Suku with me here. He is leading up a section in my office that deals specifically with working with the Auditor General and his team to make sure that we are taking the work of his office seriously and that we are doing our best to implement the recommendations that he puts forward. I want to congratulate the Auditor General on his appointment. I don't think I did that publicly before. I did it privately. Having a Caymanian sitting over there, I think, is a really great thing. But, Mr. Chairman, if I could just beg you and the committee indulgence. The three ladies that are with me, I'm so proud, Mr. Speaker, to say that Ms. Teresita, who is to your left, has just recently joined my office. She holds a bachelor's degree in public policy and management and a master's of science in risk, crisis, and disaster management. Teresita joined the Cayman Islands Government in 2017. She spent 8 years working in disaster management, but she has now joined my office, and she is now working in the enterprise risk management team, and we'll talk a little bit about that today, I think, where she now applies her expertise in risk, resilience, and crisis management to support improved risk governance across government. Mr. Speaker, the lady next to her is Ms. Chanel Layler. I think people will recognize that last name, Ms. Layler. Chanel joined our Strategic Reforms Implementation Unit as a project manager in June 2025. She's supporting the implementation of the National Security Vetting Program, as well as contributing to the development of the SRU Center of Excellence, which maybe we'll talk a bit about it today as well. Following her attaining a bachelor's in public health and sociology, she also has a master's in healthcare administration, both at the University of Minnesota. Chanel spent 7 years working in the United States, and then she came home with significant project management experience, and I want to congratulate her and thank her, and it's a great pleasure that she is now working in my office. Mr. Speaker, the last lady is Ms. Amanda Stone, who I am pleased to say has joined us just very recently as a returning graduate, Caymanian, on a government scholarship. We were able to pluck her from the scholarship secretariat, working very closely with our education ministry to get her in to the civil service. She has obtained a degree in law and business from Teesside University in 2024, and she's also undertaken the legal practice course at Leeds Beckett University and has one more examination to undertake prior to completing this course. But, Mr. Speaker, I couldn't pass up the opportunity to bring these young Caymanians here. Every one of us in this chamber, every one of you over here, continue to preach about giving Caymanians opportunities in their own country. And I think this is a shining example of having young Caymanians coming into our civil service. And I'm so pleased that the three of them are actually working in my office. I want to thank Ms. Rodriguez in my office, who has been doing her endeavor best to ensure that we're bringing in the breast and the brightest, but we're also doing succession planning as well. So, Mr. Chairman, thank you for your indulgence. I want to showcase the talent that we have in our service.
Well, I want to thank you too. And to me, it's just very encouraging to see that happen.
Yes.
And I would say to you three ladies, welcome. Congratulations on your appointments. I know, Ms. Teresita, I know you from hazard management. I know of your success and your work there. The other two ladies I don't know, and I know Mr. Kristen very well as well. But I know and feel, based on what Deputy Governor shared with us this afternoon, that you will all succeed in your new roles. And I wish you every success. And thank you to Deputy Governor for bringing them and introducing them to us and showcasing them, not just to us here, but those who are watching and listening to this program this afternoon. So thank you very much, sir.
Thank you.
Deputy Governor, before we begin, I just have a very short statement, preamble I wanted to share, sort of to set the tone, really, with regard to the hearing this afternoon. The 2024 Auditor General's report identifies a fundamental breakdown in the parliamentary accountability process. Of the 36 public bodies for which audits had been completed by the statutory deadline of the 30th of April, only 10, or 28%, had their annual reports tabled in Parliament by mid-September 2025. Additionally, 52 annual reports spanning the 5-year period from 2020 to 2024 remain not tabled in Parliament. This situation represents a serious failure of democratic oversight and transparency. Citizens and the Parliament are unable to hold the government and public bodies accountable for their use of public funds because annual reports are not being tabled in a timely manner, or in some cases, not at all. We note that since this report was issued, the 35 additional annual reports have been tabled. So there has been progress, but still a significant number remain untabled, particularly older stuff. So my first question to you, really, in your role as Deputy Governor, can you share with us your thoughts with the reasons as to why it's taken such a long time for annual reports to be tabled in Parliament? You know, we've got some spanning some 5 years, right. And some of them, well, in the case of one ministry, when we were last in Parliament here, they were tabling reports from 2013, 2014. So, you know, basically a 12-year period that they're delayed by. So just wondering if you share your thoughts as to why this is the case.
Mr. Chairman, thank you. Mr. Chairman, this is an area that both the Financial Secretary and myself have been aware of and have been working together to see how we can improve. I think we did tackle this about 2 years ago, and I think, received quite a bit of improvement. Now, last year was, I think, what I would call a sort of outlier in that it was an election year. So we can only, our job in the civil service is to get the annual reports and a cabinet paper to the minister. The minister takes it to cabinet, cabinet approves, it comes down to Parliament, it gets tabled. There were obviously not a lot of meetings of Parliament last year. Parliament was prorogued, there was an election, there was a new government. We had all of those things happening. Was that in 20? Yes. So that I think was one issue. But what systems do we have in place to make it better? And how do we make it better? Because, Mr. Chairman, I don't believe in excuses. And I heard Mr. Bryan's, MP Bryan, the Deputy Leader of the Opposition, say earlier, if you know there's a problem and you say there's a problem, but then how you intend to fix it? So what we have been talking about since this report came out is how do we get better? How do we create that sense of urgency to get it done? Because yes, the Auditor General gives us back the reports. We then look at those reports, we put everything together, and we get it to Cabinet, as I said. So I had a look at, Mr. Chairman, well, why does it take long? Well, when I talk to my team, it's DG, it's a balancing act. I got my minister on me, get these things done. I got internal audit on me, get these things done. I got you on me, get these things done. I have the Auditor General, get these things done. Some of it is a lot of competing priorities. So, and I think some of that is fair. Ministers want chief officers focusing on delivery for them. Chief officers have that sort of fine balancing act of sort of dividing up the work. Who does all of these different things? Now, the good news, Mr. Speaker, is the work to get this done is not very tedious. You're basically writing a cabinet paper that sort of gives a very high-level summary of what's in the annual report and getting it to cabinet. So I have sort of pushed back with that a bit and said, listen, I understand there's competing priorities, but everyone, I think everyone, wants to see this area improve. So what do we do? So what we're doing across the civil service, Mr. Speaker, is as soon as those reports come back to internal audit, and I can only talk about civil service policies, is that it is immediately assigned to a policy officer, a staff member, and given a timeline in which to get it done. Now, my responsibility and civil service responsibility ends when it's put on the minister's desk. The minister has to say, yes, this is good. We can do a lot of things, Mr. Speaker. We can't take a paper to cabinet. That's quite rightly in the hands of a minister. Once we get it to the cabinet, we are then at the mercy of the parliament. Parliament doesn't meet. If there's a long period of time, then the reports get a bit backlogged. As we know, there were not a lot of meetings that happened that time. So how can we get better? Is by ensuring that the annual reports are delivered in a timely manner to the government, to a staff officer who is then had that specific responsibility. Get it to the minister, let's get it to cabinet. And after that, then I think Parliament will now be reading a bit meeting more regularly. There's now a schedule, a break during the summer, other times during the year. So I feel, Mr. Speaker, with the right leadership, the right making it a priority. Another area, and again, I'm piggybacking on the Deputy Premier. Once you have seen that there's a problem, once you put your hand up and say, yes, there is a problem, and then you come up with a solution, well, what happens then? It's about accountability. So how do I hold the team account to make sure that this happens? So once we have come up with a solution, well, then let's hold the team accountable. So I have been talking with the team in POCS. As you know, we have a very robust performance management system in our civil service where I sit down with ministers, determine what is the priorities of the minister. That goes into chief officer's performance agreements, and the minister and I work together to ensure that those projects get delivered. There's also a section in our performance agreement that says sort of the deputy governor's priorities as well. So we've had priorities around, breaking down silos. We've had priorities around taking the anti-bullying and harassment course. We've had it around taking a cybersecurity course. So what I intend to do now is put the delivery of these reports to ministers in a timely manner in the chief officer's performance agreements so that I can then hold them to account for that performance. So I feel with FS and his team doing some pushing on their end, I do the pushing on my end and putting the agreements in chief officer's performance, putting the requirement in chief officer's performance agreements, that I think we will see substantial improvement. So that's the plan.
Who ultimately is responsible then for ensuring the timely tabling of these reports? Who could be held responsible for doing it?
I don't think it's a civil servant. Like I said, Mr. Speaker, and I'm not shying away from responsibility here, but really the job of the civil servant is to develop a cabinet paper and give that to their minister. Yeah. What happens after that, we really don't have a lot of control over. The minister has their own priorities, their own things that they want to put at the top of the pile. There's a caucus process, there's a cabinet process, but our job is to get the paper done and to the minister. But I think everyone wants to achieve this, to see this recommendation in or this concern in the report go away. I think it can, with cooperation from everyone.
Okay. I appreciate that candidness.
Mr. Chairman,
Go ahead.
if I may, first off, good afternoon,
Good
DG,
afternoon,
and good afternoon to your team that is here. I just want to quickly say that as a witness, anything that we say here today is not to cast blame at anybody in particular.
Yes, sir.
But just trying to get to the systems of accountability as streamlined as possible. Yes. And I know that you fully understand that.
Yes, sir.
You definitely made it hard for us to ask any hard questions with that amazing team that you brought in. But more,
Yes.
yeah, he's a veteran. I have to concede with you,
Sure.
as a former minister, that you have a very difficult job, which is trying to work with the minister, but also get them to prioritize putting these forward. And I must say, and I think this is important for the report that we will do after this hearing, is speaking to the Speaker of the House, where the government has given commitments to regular sittings of Parliament, because that also dictates the ability for those reports to be tabled. So that has to be a factor in this. But without trying to put you in a difficult spot,
Yes, sir.
would you say majority of it is because of late sitting of the House, as well as the ministers needing to prioritize what they're going to get to caucus and cabinet? Because I in my last 4 years, I don't recall it actually being anything to do with the civil servants at all, but more so, when am I going to send it to caucus? When am I going to get it to cabinet? And after that, when is my premier going to call the House for me to get it tabled?
Yes.
I don't recall ever one time yet where I go to my chief officer, at least I can speak from my ministry I was in charge of, boy, where is this report? It was more so, don't forget to send this in because you need to get it tabled by this time. There's a lot of reminder to me as minister.
Yes.
So I suspect that majority of it is not the civil service at all. Would that be a fair assessment?
Sir, so we have to take some of the blame, sir. I would never want to say that it's all on one side, because again, it is a result of some of those competing priorities. So I can't guarantee you, sir, is that the next day that when we receive the annual report from the Auditor General, that 2 days later somebody prepares a cabinet report and get it to the cabinet or to the minister. So I think that there's probably some lag there a bit when the report comes in, and that's why I said that we would like to have a system in place where as soon as that report comes in, it is assigned with a timeline. Let's get it to the minister. I think that can work. But sir, I am having looked at this area carefully. There are a number of steps that has to happen for it to get down here, and I don't think there's any one person or entity that is at fault with this. I like, Deputy Premier, I like your right, Mr. Chairman, through you, of having regular scheduled meetings of Parliament. The Auditor General has been recommending that for years, so that there can be, I can advise chief officers, okay, there's a meeting in Parliament on the 14th of February, there's another one again in April. Obviously, when you get the reports back from the Auditor General, I think that's the end of April, there you go. So that also is a delay as well, Mr. Speaker, in that statutorily, the Auditor General has to give us the reports in April. So if we have a meeting in January, there's no reports to be laid because we haven't got them back from the Auditor General yet. So if you think between April and December, it's not that much, there's not many meetings of Parliament that happens that would give us all of this opportunity. Now, I really believe that we can get better at this, Mr. Chairman. And with, as the Deputy Premier said, regular scheduled meetings, we pushing hard on the civil service side, ministers agreeing to let's make this a priority. I think we can move from misery to magic. One of my favorite things. Yeah.
To you, Mr. Chairman, I as much as I hate to correct you on this, I'm no longer the deputy premier, though I missed the position.
Yes.
Tremendously. I'm the deputy leader of opposition.
Yeah.
I know it's just
Sorry, sir.
because you said it so much for 4 years. I could totally
Yes,
understand.
sir. It's hard.
I want to say something on behalf of our committee that there is another way to give a little push in the right direction. Because I don't want to put you in an awkward situation or your chief officers to do that. But from a good governance responsibility, the governor knows that timely reports is a part of the scrutiny of accountability.
Yes, sir.
So can you pass the message on to the governor to say, please have a word with the premier. They have weekly meetings to say, can he ensure his ministers prioritize that? Because knowing the process of caucus, like you said, they're not very complicated papers. There's usually just a high-level summary presented. Most ministers will have gotten it if they chose to read it, or if they didn't choose to read it. It's irrelevant because the paper has to be, and the reports have to be tabled either way.
Yes,
so if the premier, through the governor's pressures of good governance and timeliness of reports and all that is important, particularly for us who police and scrutinize that maybe that might be the pressure. Along with us talking to the speaker and highlighting in our report from PAC that timely parliamentary sittings, the cabinet and premier prioritizing that on the inside, and the commitment from the civil service of to having it ready for the minister, that three-prong approach, I think we can definitely improve this. So I do appreciate that, and in respect to this subject area, that's all I have for the government.
Go ahead.
Thank you, Mr. Chair. Just a broad question. You mentioned enterprise risk management earlier on, and I too welcome the folks there. Good to see them. Yesterday, we heard from the Chief Officer of District Admin and Home Affairs, and from his testimony, he had, I use the word embrace the concept of enterprise risk management. I commended him on that, but also he had hired in, or was hiring in, someone with the expertise and knowledge to be able to help him and his minister with what was needed to be done with recognizing potential risks, looking and finding solutions for potential risks. Is he unique in that regard, or is that something that's being encouraged throughout the civil service, that they actually hire on board, certainly especially for the larger ministries, someone to assist with risk management within the ministry? Because I recognize that I think one gentleman, I think it is that you've hired, won't be able to actually do that on his own.
Right. Mr. Chairman, I thank the member for the question. Mr. Speaker, I think that ministry is involved in public safety. So I endorse whatever moves they want to make in terms of dealing with risk. What we are doing through my office is we have our Chief Risk Officer, along with Ms. Teresita. They have identified a risk management framework for external risk and internal risk. One of the risks that we have identified, for example, in the civil service, again, Deputy Leader of Opposition, I apologize if I keep mentioning your name, but I listened to the hearing yesterday and I heard you talk about this, is about major project delivery, for example. And so your words that said, I can't remember when a government project was delivered on time. Those are words that, as DG, I don't ever want to hear a member of this House say. So the issue is, well, then what are you doing about it? So I would be happy to talk about that when the time comes. But what I'm just saying is that we have done a tremendous amount of work. We have a really skilled team, Ms. Teresita and Mr. Mike Slade, who is working on this to identify the risk. What are the areas there's a serious risk to our organization? And then what are the policies and procedures that we're going to do to mitigate against those risks? Right now, the very topical thing, Mr. Speaker, is illegal migration. What's going to happen if Cuba no longer gets any oil and people start to suffer? Are there going to be a mass migration? So we have a team looking at that. That's in the Ministry of Home Affairs. How are we going to be able to handle, God forbid, if a few thousand Cubans arrive here in a short period of time? So those are things that we are now embedding in the thought process across our civil service. We don't want to be reacting to these things. We want to have identified the risk and done everything possible to mitigate against the risk.
Thank you. Thank you, DG.
I think, DG, through you, Mr. Chairman, to the Honorable Deputy Governor, you and I have had this conversation in the past concerning the difference between the portfolio of the civil service versus the portfolio of the public service. And I think that the members of the public needs to recognize that your responsibility to some extent just goes as far as the core government, and the SAGCs themselves is an entity unto themselves. Yes. So I think people need to put that in the context that those are outside your areas of responsibility. One of the things, and I did hear when my good friend, the member for Georgetown Central, said what he said yesterday, and after he said it, what did click to me was we don't do enough of talking about our wins, because we focus on the things that don't go right, and that is what goes into the public domain. Yes. And no one speaks about the stuff that we just take it for granted. As I've often said to him politically, that in this country we take normalcy for granted sometimes. And as a result, so I think from that standpoint, I mean, he's not incorrect in his statement, because we only talk about what goes wrong at PSC. That's the reason why I thank you at the start, to let people know that people still do a good job.
Yes, sir.
But again, it's just a matter of putting it out. And I think when we look at even the attrition rate within the civil service, we don't talk about the people, because people talk about civil servants having like lifelong jobs, like they can't be moved for non-performance. And we see the numbers in terms of how many people is managed out a year for non-performance. But I remember having this conversation with you, and you were saying, being on a small island, you don't want to, ruin anyone's ability to get a job elsewhere. So you don't talk about people that are managed out for non-performance. But in the public belief, they're just that the civil service is full of people who's not performing, when a lot of non-performers are managed out that is not spoken about. So I put it out there because it's important to me and the public and every member of parliament, should I say, that people do have confidence in our institutions. The policies that we set has to be carried out by public servants. And if people and the public have a view that the public service is not delivering, then it means that the policies that we want aren't also being delivered effectively. So I think it's part of just changing the narrative, because I mean, I hear the same thing that that many people hear. The government ain't doing this, the government ain't doing that, and everything else. But yet, when people are in a jam, is the government that they want to get to. So with that preamble, what I want to touch on first is to thank you, and I said it in Parliament before, when I raised the issue about the HSA compensation, that your team did their job. Yes. You investigated, and we saw the report in the Compass, where your internal audit services team recommended funds to be repaid. And what people also need to recognize, which I also mentioned in Parliament, is that under I think the Public Service Management Act, where the remuneration of boards are something that you also basically approve to make sure that board members who are doing this voluntary work aren't getting paid, I guess, as crazy as they should have. So with all of that, my first question is, in terms of the money or the recommendation of the funds being repaid, has there been any progress in that regard?
Yeah, Mr. Chairman, first I want to thank the member for highlighting the work of the civil service. Mr. Speaker, Mr. Chairman, there's a, yes, okay. I'm promoting everybody today, yes. Mr. Speaker, there's a reason that I feel good about retiring in July. And those people behind me are one of those reasons. Because, Mr. Speaker, what we have achieved is that Caymanians who are in other private sector entities are now flocking to our civil service. And I mean that in big numbers. I meet people in the elevators, I meet people in the corridors, and they're new faces, and I say, I haven't seen you before. And he says, yes, Mr. Manderson, I just joined 3 weeks ago. I said, where do you work? And they're coming from the Big Four. They're coming from other law firms, other firms across the island. And I said to them, why did you join? And the single biggest reason why they're joined is because a family member or a friend told them, this is a great place to work, where you are valued and appreciated, and that you have purpose. It's very difficult to tell someone working in the private sector who is dealing with lawyers in New York, making them rich, that you have a lot of purpose. But working in the civil service, where a decision that you make, like we talked about with the member from Boddentown West, that changes people's lives. Some of your own people's lives you can make better by just simply doing your job. So, Mr. Speaker, I am very satisfied that we are doing our job to support the government of the day. The member is right. Ministers can't be in the classrooms. They can't build roads. They can't fix issues that happen across the country. That's the job of the civil service. So we have to be ready and able to do that. And Mr. Speaker, I am leaving confident that we have a high-performing civil service that will continue to make our country proud. I get more credit from the people overseas than I do unfortunately, from in Cayman. When I talk to my fellow deputy governors and I say, this is what's happening in Cayman, they're saying, Deputy Governor, you got a real thing, good thing going there. When I tell them about the relationships that I have with the opposition and the government and the premier, sometimes they're jealous. When the governor goes to the governor's conference and she tells them what's happening in Cayman, governors come back to me and says, DG, I felt a little embarrassed because it felt like I was bragging about all the things that happened in Cayman in our civil service. So we got a lot to be proud of, a lot to be proud of. I think I am going to spend the next 6 months of my time screaming about the civil service and all the things that we're doing well, and just showing the public that they have a right to be proud of our civil service. But you asked a question, and I must tell you, sir, I completely forgot the exact question you asked me. So
the IAS report.
Yes.
The IAS report.
Yes.
Paying back the funds.
Yes. So, Mr. Speaker, Mr. Chairman, we received a whistleblower complaint around what was happening at HSA. I did what I was supposed to do, a part of good governance. I referred it to the internal audit. They have now done a report. The report was shared with the board. The report, in some aspects of it, has been made public. So that was my major responsibility. Now, obviously, internal audit sits within my office. I don't obviously direct them what decisions to make. I am there to ensure that what they say and what the recommendations that they do within the civil service get implemented. My remit, as the member said, for SAGC is a bit different. I can, I guess, push and prod a bit, but that's to the extent of my responsibility. So I know that the Ministry of Health is taking this matter very seriously. They reached out to my office, the new minister, upon coming into office and being told of this problem, and asked if we would recommend a new board remuneration strategy, which we have done, and which has now been approved. So they've gone from per meeting to per month, which was, I think, the right thing to do. I think it's fair. So I can give an undertaking, certainly, sir, to speak with the minister, speak with the chief officer and the Minister of Health, and pass on the committee's expectations that the recommendations in that report will be taken forward.
Thank you, Honorable DG. Just yesterday, we had touched on the issue of centralization of, some of the finance function. One of the things, going on my earlier thread of the portfolio of the public service, is another function I think that we need to start looking back on is the centralization of the HR function. I remember when I joined the civil service first in 1989, I think it was, we went through the Public Service Commission. And ever since the changes that we have made following that New Zealand model, we have gone into this decentralized approach. And what we have seen now is some ministries doing different things than others. And so we need to get some level of uniformity. I know you have your regular meet with your chief officers to try to keep everybody on the same page, but being in a decentralized environment, it becomes very difficult from that standpoint. So that's one of the things I would like to get your view in terms of what do you think it would take to get back some functions of the HR at a more centralized level. I don't want to say the Public Service Commission or but something similar where we can start, getting that kind of going back to where it was before.
Thank you, sir. Mr. Chairman, through you. Mr. Chairman, it is something that is certainly high on our radar. The chief officer and the team of the chief officer in the portfolio of the civil service, Ms. Gloria McField-Nixon, has raised this issue with me. Incoming ministers have raised the issue around the numbers of people in HR, the number of people in finance. So this is something that we are going to look very seriously at. Can we develop a bit more streamlined approach? Can we look at, for example, we have seen 4 or 3 or 2 ministries applying for an accountant. Why does 3 ministries have to do 3 separate ads for the same position? Should we just do 1 ad and the ministries come together, and when they do the recruitment, they hire 3 accountants from the same recruitment? So it's those kind of sort of easy wins that we can do to centralize, get people working together, and be consistent in our approach. So, sir, you're pushing on an open door. There is no pushback on this. These changes were made back in 2005, I think. We're now over 20 years on. It's the time to review and to see how we can do things better. And I think there's always those opportunities to do it. We can look at how we can reduce cost by simply doing things together, not working in silos.
Thank you very much, DG. And my final question to give my other colleagues an opportunity. I know we talk about the size of the civil service, and the public may be surprised to know that back in, I think, 2009, the civil service was much larger than it is today, despite the growth in the population. And I think when people talk about the size of the public service, in other countries, the hospital and even the fire and so forth is actually outside of the public service, whereas we're counting a lot of people on government payroll that in other countries sit in different entities altogether. But one of the things, DG, that you touched on in terms of attracting young Caymanians, bright Caymanians, to join the civil service, one of the things that has been paramount of this hearing so far has been the issue of the post-retirement benefits. And one of the things that is now, I think, something that we need to look back at is bringing back the defined benefit plan for all civil servants across the board. Because as it stands right now, when we look at the 12% contribution rate that the government now has for civil servants that are joining, we already know in the private sector that the 10% contribution rate is vastly insufficient. And we know upfront that the 12% contribution rate will also vastly be insufficient. And we can't have civil servants working 35, 40 years and still can't retire after giving that much service to the country. Now, one of the things, and this is something I'm just giving you a heads up that I'll be pushing on in Parliament at a bigger picture so you can, I guess, start preparing for it, is we have an unfunded medical liability right now of $2.3 billion. Is to take a holistic look at the overall retirement benefits. And if you think about it, if a Caymanian choose not to retire in Cayman and want to retire wherever the grandkids are, offering them a post-retirement healthcare benefit that they won't be here to collect becomes almost moot. So is it better off for us to start looking at giving a proper pension, a pension that can actually, for them to afford whatever healthcare plan they may need? So we already have the liability. The question is, should it be a $2.3 billion unfunded medical liability or a $2.3 billion unfunded pension liability, but at least give public servants after 30, 40 years of service a proper pension? But $1,500 is not going to cut it. And the way in which the world is going right now, all of our pensions are tied up with the US dollar. Everyone see what is happening with the US dollar and everything else. We need to start looking more seriously at those benefits. So I would like to get your thoughts. I haven't sat down now and running a civil service where some of your older employees are on defined benefit and can retire after 33 and 30 years, and some are on a defined contribution plan and can't retire even after 40 years of service at this rate. I would like to get your thoughts on that.
Thank you, Member, and Mr. Chairman, through you. Mr. Chairman, I think everyone that was part of that 33 and a half years have now retired, and I think I'm one of the last people that is in the DB plan. Yeah. So I take the member's point. That is something that we will have to discuss a bit more. Again, Mr. Speaker, there's a lot of criticism around 5%. 5% matters. A 5% COLA matters. We're able to bring in talent because of better pay. I believe, I don't have the exact figures, but our salaries, during my time as Deputy Governor, I'm very proud to say I think salaries have increased by over 20%. And that's why we have been able to pay good people to come into our civil service. It's now attractive. But it also goes down to the pension. When we moved all of our employees to $3,000 a month, that made a difference to those hardworking people who are out in the field collecting your garbage at 2 o'clock in the morning that was being paid under $3,000. That made a significant difference in their lives. Now, and when they retire, what I think we all want to see is that no civil servant who retires has to now go back and ask for social assistance. I am with the member in that we would love for every one of our civil servants that when they retire, they have a livable pension, that they don't have to rely on anyone. Now that cost, but I think it's the right way for us to go. Why are we not putting more effort into looking at that? And obviously, a lot of that is on me. Because if we don't do it now, we're going to do it later. So we're just kicking the can down the road. We're just kicking the can down the road because when somebody retires and their pension is, $15 or $18 or $1,900 a month, thankfully in the civil service, you won't have to worry about health care, but you have all the other bills that we all have. So, member, I am happy to take forward that discussion with you. We have to, I think the government has to lead the way in these areas to show how you really should take care of your employees, both when they're with you and after they leave. We're also a member in agreement about what's happening in the private sector as well, where people are retiring and their pension is $1,500 a month and their health insurance is $1,000. What's happening to those persons? They're coming to the government. So I think there needs to be a lot of discussion around national pensions, but also then what we in the civil service can do to be part of that solution. And I'm quite happy to have that conversation, sir.
Well, DG, I'm very happy to hear that because I'm serving notice now that I will be pushing for defined benefit pension plan for all Caymanians, and I can't go and push the private sector to do it when the government needs to lead by example. So I think we're on the same page with that, but we have been kicking this can down the road for too long, and it's going to get worse. So I've just drawn my line in the sand, but I will yield for now.
Deputy Governor, I just want to go back to one of the questions that Mr. Saunders asked you with regard to the testimony you gave with regard to the issue with the HSA board. Yes. You said that you gave the minister advice with regard to a funding model for the payment.
That's correct.
To move to a funding. I remember some time ago, and it certainly could have been as far back as when I was Minister of Finance, that you had embarked on a project to harmonize the compensation of all of our boards and SAGCs.
Yes.
Was that project ever finalized and sort of the funding models all agreed?
Yes, Mr. Chairman, yes, the policy was finalized. It was completed. The Deputy Premier and his government approved the policy. We have been doing a pilot now for probably over a year and a half to see that it actually is working, and I think it is. So if the committee wants a copy of the policy, I'd be happy to share. But it is a very robust policy. It sets out very clearly how you determine the remuneration of a board and a board member. It looks at the entity, how many meetings do they have, what is the level of budget and risk, but it also builds in a bit of volunteerism because, when people come and serve on these boards, sometimes their employer is also paying them as well, and we believe that people should be encouraged to give back to the Cayman Islands. So what it says is, you will be properly compensated, but don't expect to get, a huge, don't expect to get a livable remuneration. So I'm happy. The policy is done. It's approved, and I'm happy to share it.
Yeah. Well, thank you for that offer. Yes, I'd like to take you up on it,
Sure.
so wouldn't ask you to share it with the committee. Thank you, sir.
Mr. Chairman, through you, I'm going to do a little bit of self-praise here. I would like to highlight the fact that in the last administration, I was the one that triggered that completion of that report. And I'm quite sure that the DG would confirm that as I saw the variations of the different board members. I actually got some licks from some of my colleagues on that too for doing it, but it was the right thing to do. I didn't say it was you. I just saying some of my colleagues, because you were there, you'd remember, because you stood beside me with that.
Mr. Chairman, I so confirm. The deputy leader of the opposition is correct. He and I worked together on this for quite some time, and he certainly was in cabinet when it was all approved. So I think what we have is a really good policy that can stand up to public scrutiny, and I think the government can defend the policy. Yes.
Thank you so much, DG. DG, I want to say something, and then I'm going to go into internal performance review, because I think you recently done one, and I'm hearing that the review on the civil service is looking good. So I want to hear about it. But you see, the thing that makes us as good as we are, that allows you to brag, is the pursuit of excellence. So the criticism, critiques, and stuff like that sometimes is hard, but it's that pressure of being the best is what keeps us the best. Because it reminds me of the last budget hearing where people were saying, well, the police are doing good. Serious crime is down. I'm not going to be happy until there's no crime at all. Because when we keep that bar high, then we will always be able to brag. So don't feel indifferent or bad when there's constant pressure of excellence.
Yes, sir.
And I know that your viewpoint is the pursuit of excellence is something that you aspire to in the service, and that's why the service is doing well. So let's talk about that performance review that's been done lately.
Yeah, Mr. Chairman, I think the member's talking about our staff engagement survey. Before I answer the question, the member is right. I have taken great hits for saying that we can be a world-class civil service. And I get occasions, well, DG, that's not world-class. And that's okay, because we're on a journey. I have never said that we were going to be world-class next week. I said we were on a journey to achieve our vision of being world-class. And why do I believe that we can be world-class? Is because of our people. 70% of those people are our people, and I have great confidence that our people working with the non-Caymanians in the civil service can deliver world-class services. Tell the family that the member from Bondon West talked about yesterday, that they don't have a world-class civil service when we are able to react to their needs in minutes, not days and weeks, but within minutes. So I think our vision is right. The people of the Cayman Islands deserve a world-class civil service. The government deserves a world-class civil service, and certainly civil servants deserve a world-class civil service. And our job must be to keep that bar high and to do everything possible to achieve our vision. Mr. Speaker, Mr. Chairman, we just completed our staff engagement survey. The news is out. I haven't taken the survey to cabinet yet, so I'm not going to be bragging too much, but as the former Minister of Tourism can be justly proud in that his former ministry has topped the civil service engagement survey with a 91% engagement score. So rightly, he was there for half the year, so he can take great credit for that. But Mr. Speaker, Mr. Chairman, it shows what we can achieve with ministers working together with our chief officers, working together with the staff, all joined up to make our people's lives better. Mr. Chairman, more civil service entities got over 80% than ever before. Our staff engagement index moved from 73% to 74%. So everything is moving in direction. But Mr. Chairman, there is one area in the survey that I look at every year to say, what is that percentage? It is the percentage of civil servants who are proud to be a civil servant. And Mr. Chairman, I am proud to say that number is 90%. 90% of our civil servants are proud to work for the government. Mr. Chairman, you and I know, I think everyone here knows, when your staff is proud to work for you, the organization will never fail, because they will work night and day to make that organization successful. And that's what we're seeing. So I am very, very proud. Someone told me a long time ago, DG, you leave when things are good. So, things are good. And I want to, it's a great gift for me leaving the civil service when our engagement scores are so impressive. Yeah.
Wow. DG, you're making it hard for me to go hard on you. Ease up. DG, I want to kind of summarize a little bit of these final questions from me, at the very least, in an area where I think we kind of somewhat addressed it already,
yes,
whereby, our supplementary appropriation bills are obligatory to be brought to Parliament by a certain time. And I think this kind of falls in that same realm of those reports whereby they can be done,
yes,
given to the minister. If the minister gets it to caucus to be approved, and also whether Parliament is sitting to obviously deliver them.
yes,
A lot of that. I mean, obviously Ministry of Finance will have a little bit to do with that for that paper. So it's not as simple as the other reports.
Yes.
But I suspect that a lot of that problem is exactly the same problem with these areas. Is that fair?
Very fair, sir. I can say, though, that we have done all our work. The bill is prepared, and I spoke to Mr. Nixon earlier, and I think he can provide a very positive update as to where we are. If Mr. Chairman, if you would allow.
Thank you. Through you, Mr. Chairman, on the issue of the supplementary appropriation bills, as Mr. Bryan has just highlighted, it is very similar, sir, to the other in terms of bringing the annual reports and the reasons for the delay. 2025 was an extraordinary year for us in the Ministry of Finance, as is every election year. There's a lot of things happening concurrently. So our teams were fully deployed dealing with all of the budget matters, the changes in government, et cetera. But the supplementary appropriation bill, Minister Anglin has undertaken. He just met recently with our team in the Ministry of Finance and has agreed that that bill will be brought very shortly to Parliament, so within the first quarter of this year.
Thank you so much. As a member of PAC, I definitely will give sympathy to the areas of house sitting, management of ministers getting the paperwork done, but I'm not going to be so sympathetic on a funny year of elections. We're going to have elections every 4 years, right? Now, there was one extra thing that happened, which was there was a government, a number of ministers resigning, which would have affected it because other ministers were taking at the role of former ministers. So there's a little sympathy for that. But I don't want this Parliament or this committee to think that it's okay because when there's an election year, you can still be late. That's not what accountability is about. You prepare for that in other ways, just like how you budget and plan. So yes, I think that within our report, we will highlight the fact of Parliament sitting. And I think the Deputy Governor gave an undertaking to ensure, to pass on a message to the Governor from a good governance perspective. I confirm that undertaking?
Yes, sir.
Okay, so I think we will be well on our way. With that being said, I want to go to a question in respect to public bodies, and I think my colleague highlighted the unique responsibility you have constitutionally, and that your power only goes so far. But the Auditor General's report noted over 20 audits remain backlogged across the public sector as of September 2025, which is just about 4 or 5 months ago. This includes 5 critical year backlog for the Ministry of Health and Wellness from 2020 to 2024, and 4-year backlog for CIAA for 2021 to 2024. The backlog undermines the Parliament and the public ability to hold public bodies accountable for the use of public funds. And we're talking about hundreds of millions of dollars. So it's important for timely audits to be done. We note, though, that there's 2 backlog entities have been completed since that report that was done by the Auditor General. Acknowledging that you can only do so much to SAGCs, you can't direct, you're in charge of the civil service. Is there anything you think that can be done to improve in this area from your position?
Mr. Chairman, through you. Thank you, sir. So I listened to the testimony yesterday of the acting CEO, Ms. Ogaro, talking about the health ministry. So I think I'm not going to go down there. I think, Mr. Chairman, you quite rightly said, we've been talking about this long enough. Let's find a way to get it done. So the team has given an undertaking to discuss this with the Minister and the Auditor General and find a solution. So how do we not get into backlogs? And it doesn't, I mean, there's a couple of entities here. There was, I think, 2 civil service entities, and then there's some SAGCs. It happens for a number of reasons. I think you've heard what the Ministry of Health talked about. It's almost like the perfect storm, the chief officer leaving, the CFO becoming the chief officer, not having staff, COVID, all these things. Normally, things run very smoothly. When you see something like this happen in terms of a backlog, there's normally a trigger as to why this happened. And Deputy Premier, your observation about performance is where this comes in, because where we want to get to is that when those abnormal things happen, we are prepared and we have seen it and we have identified it as a risk and we have put things in place to ensure that it doesn't happen. So I can say now with confidence that I think the civil service is certainly prepared much better today than we were a few years ago in terms of being more resilient, identifying that this could be a problem, putting things in place to combat it. And I think the same would happen probably in the SAGCs. I'm not sure what happened at the Civil Aviation Authority, but how do we get out of this? So speaking about the Ministry of Health, I think we have a plan. I will certainly talk to the relevant chief officer about the airports authority. Again, I can push, I can nudge, and I'll be happy to do that. But at the end of the day, they have a board, and that board is the one sort of accountable along with the CEO to get that done. But I do believe, speaking with the Auditor General, that there had been good progress made with that entity. So I think we're on the right track, and I am confident that I believe when we are back here in a year's time, you'll see a difference.
Thank you, DG. Mr. Chairman, I'm about to wrap up now with my line of questions for the DG. I want to talk about the role of our structure of the Cayman Islands power, because the public sometimes don't fully grasp the delicacies of the makeup of the Cayman Islands and who has the power and who doesn't and so forth. So you have SAGCs which don't report to core government, which is you, but yet the chief officer who is for the minister that's overseeing that is the minister who has to be on the board, ensuring that the board understands these legal obligations. That chief officer also could be called by the governor of the country, who is also responsible for good governance. Right. Good governance for these reports in a timely manner could be a factor. Hopefully everybody understood that. Now, I'm of the view that the governor can step in, though there are entities outside of the civil service under the remit of good governance, by way of saying, listen, this entity needs to have their reports done on time. Because when Kenneth Bryan comes down here and says the projections are bad and she's responsible for good governance, I didn't want to take the licks because that's what I'm going to do. So if, fair enough, I know you can't do it, and it's unfair to your chief officers, they will nudge. I've seen them do it before. I've seen my chief officer go to CIAA, one of the entities that are in question, saying, listen, you got to do this. But if they don't, then what can he do? He can't come to you and say, fire anybody at CIAA. Right. They're an independent entity. But there needs to be understanding of the obligation of accountability to the country's billion-dollar budget and control mechanisms. Right? So without these things being done in a timely manner, we cannot say whether anybody's stealing any money, whether we could be saving any money, whether it's corruption, or we are a world-class country. We can't say that. The EPS is important to understand, and we're really behind. So we need this pressure to be applied, and I'm going to ask you to give this commitment as well. Not only the civil service reports, but Her Excellency the Governor needs to understand under the remit of the Constitution of good governance, she needs to ensure that these entities, because these entities have to report back to Cabinet, understands they have to meet the law. So please pass that on from this entity, the PAC. Thanks.
Mr. Chairman, I'm happy to do that. Mr. Chairman, also in the current government's SPS and some of the projects that they have put forward, one of those is to review the Public Authorities Law and Act. And I think that is also going to give us an opportunity to help define that relationship, sir, that you're talking about, to ensure a bit more accountability, working together, who can actually hold people, to account. I think that whole area needs to be looked at again to make sure that we're all working together for the same outcome, and that actually works very well. So, sir, I think my office is going to take on that work in terms of reviewing the public authorities law. Certainly, sir, we'd want to hear, talk to you, hear your views about the relationships, so that when we come down here, we will have a fit-for-purpose law. Yeah.
Ms. Judy, you have some questions?
Thank you, Mr. Chairman. And DG, good to have you this afternoon.
Yes, ma'am.
I think we've kind of pounded the backlog to death. So my questions were basically around the backlog audits, because we've already dealt with all the annual reports that have not been completed on time. But I was just hoping, I know that with you having the overall responsibility for the civil service, I was just hoping that you would have been able to give us what would be your role. And I know you already, you said that you could only push, you can't do anything more than that. So I just thought maybe that there was a bit more than pushing that you could do with having the overall responsibility. Maybe I'm wrong, and maybe that is not within your remit, but I thought so.
Yeah, I mean, Mr. Chairman, just to be clear, when it comes to SAGCs, I can push and prod. When it comes to the civil service, I don't have to push and prod. I can just make things happen. So
that's what I was thinking. So I was hoping you would be able to say.
Yes.
So that we could come up with a plan of action here today.
And I just told you what that was, ma'am. Yeah.
Okay.
Yeah. Yes.
Okay.
So what I said, member, again, if you take the SHGCs out, my role that's stated in the Constitution and the Public Service Management Law is to manage the performance of the civil service. That is my one job, and I have all the authority in which to do it. So accountability is something that I'm very used to, and I have a great relationship with all of my team, and I am blessed to have a really great team around me. So what I said to the committee was that, how do we move the needle on backlogs or not getting the reports to Parliament in time, was to ensure that in every chief officer's performance agreement, there is a section that says you will get annual reports to the minister once received within a certain time frame. And then my job would be to hold the chief officers to account. In relation to that is getting reports to the Parliament, which was an area flagged. And then in relation to in the backlogs, that would also go into their performance agreement as well. So once they, for example, the only civil service entity that I'm aware of that has any serious backlogs is the Ministry of Health, which you all examined here yesterday. So once the minister makes a decision around that and gives the timeline, then I can then work to hold the team to account to deliver for the minister on those timelines.
Okay. The Auditor General's report notes that there are 20 audits remain backlogged across the public sector as of September 2025.
Right.
Are they all to do with Ministry of Health and Wellness? I don't think so. No.
Well, the Auditor General can say, but the majority of those, but certainly there's a Ministry of Health has a number of years. I believe there is, PAHI has a couple, but the Auditor General can give the exact figures.
Yep, through Mr. Chairman. That there are 4 that relates to the Ministry of Health, 4 for the Cayman Islands Airport Authority. The EPS also has, well, EPS is 3 years now because we finished 2021. The Total Center has 1 year, National Housing Trust 2, the Ministry of Planning 1, Cayman Airways 1, and the museum one.
Okay, so most of them do center around
Yes,
the
the majority
SAGCs.
are, yes, majority are SSGCs, yes.
Okay, so basically, DG, what you're saying is you don't have too much remit over that. You can only push and prod, but those to do with the civil service, you definitely can have a greater role around those. So, any specific timelines that you would say those extra procedures are going to be put in the chief officers?
Mr. Chairman, through yes, we are starting our performance management cycle now. So those, I think, performance agreements have to be completed either, I think, within the next 3 weeks or so. So that's when we will insert those in the agreements.
Okay.
So certainly within the next, I think, 2 to 4 weeks. But I would think 2 to 3 weeks.
Okay. Thank you so much for that. That would make a great difference.
Yes, ma'am.
I was just happy to hear you say that you do agree with the centralization or trying to move toward the centralization of certain government services, especially going to do with HR and other services that are presently not really centralized. Because, I mean, as you and I both know, that this will prevent a lot of wastage, and those same employees could be used in other areas. So I'm happy to hear that. Thank you so much for what you're doing. You did say this could be your last PAC. I don't know that. We don't know what tomorrow may bring.
Yes.
But if it is, I just want to say thank you so much for all that you've done. You are a fellow West Bayer.
Yes.
So you know that I'm very proud of you.
Yes, thank you, ma'am.
All right. So thank you so much.
Thank you.
And God, Richard, continue to bless you, and whatever your future steps, where that takes you, I know that he will continue to be with you and will lead you.
Thank you very much, ma'am. Thank you very much.
Yes, Mr. Chair. I just want to quickly join voice with that last sentiment. And so I've had the privilege of working with you over 8 years directly, and I commend you, and hats off for all you've done. Thank you for all your work. I want to join voice also with the comments with regards to looking at centralization of particularly, I think HR was mentioned, but finance. I think there are great potential benefits, and I hope those will be explored. You mentioned earlier on, I should have made a better note of it, but you mentioned that relationship between, I guess, government proper and the SAGCs was being reviewed. Remind me what you said about that, please, if you don't mind.
Mr. Chairman, through you. So I said that the government of the day has one of their priorities in the SPS is to review the public authorities law. So that will give us an opportunity to examine the relationship between the SAGCs, the ministries, chief officers, and to see how we can make that work a bit better. Yeah.
Thank you for that. That's very good to hear. You mentioned you listened to the hearings yesterday. I hope you have a chance to listen to the hearings from earlier this morning as well, with regards to issues that the HSA have been having, it's been dragging on since 2024. And it would be good if that relationship could be a bit different, so you can maybe, when needed, do a bit more than prod. So I will leave it at that. One other item, if I could ask of you, the recent budget session, if I recall, it was confirmed that the additional revenue measures in the budget, that they were not considered when the potential changes or increases to cost of living was put forward. What I'm curious about is has there or is there going to be an initiative to see exactly what impact these measures will have on the cost of living? So updated figures could be provided, because that obviously impacts any salary increases that civil servants would likely have.
Mr. Chairman, I'm not aware of that exercise, sir, but I'm certainly happy to go back and talk to the elected government and report back. But I'm not aware of that exercise happening. Yeah.
DG, I meant to not ask you any more questions, but something just came to my mind. Obviously, civil servants pay. You always hear me fight for that, no matter what they want to say. The civil servants deserve the money. We took the licks together with that 5%. They can keep on talking about it if they want. That's my opinion. And I personally think they need to get the rest that was committed to them, because the 8% that was promised. But with that being said, the government has recently done some significant fee increases. And I don't think any of us in this room have not heard about somebody say something about the cost of living increasing. This is now going to make it even more important about the salary for the civil servants. Are you aware if there's been an economic impact assessment done on the cost of living for Caymanians and everybody that would cause you to prompt or promote or try to request government to consider that COLA that has not been budgeted for, but depending at the end of the year, maybe some savings, because I'm genuinely worried, not only for the civil servants, but for everybody, but we're talking about the civil servants for now.
Yes, yeah. Mr. Chairman, through you, Mr. Chairman, I'm not aware of a study. In discharging my duties, I've obviously spoken to the Minister of Finance around remuneration and honorariums and all of those things that our staff deserve. What we are working towards is performance-based pay in the service. Which is different from the elected government giving the civil servants an honorarium, for example, in December. What we are looking at, because there was a time, Mr. Chairman, when if you'd asked me about performance pay, I would say that civil service is not ready. It wasn't ready because our performance management system was not as robust as it is today. So in other words, our managers having the courageous conversations with their team, are they grading them correctly? 1 is very poor, 5 is you're the very best. Was everybody getting 5, or was there people getting 4s, 3s, 2s? Hopefully we don't have any 1s. But I can say today, Mr. Chairman, that I am, without a doubt, but I believe that the civil service is now ready for performance pay. Again, I don't want that to have to come out of savings. That is something that should be budgeted for. So the government can decide in December, listen, because of your hard work, here is $1,000 for Christmas for you and your families, which is not based on performance. It is a gift from the government to realize your hard work. But come January, when the performance cycle is finished, in other words, you're evaluating the year's performance, that at that time, there is a decision made around performance pay, which is then paid in February or once the performance cycle has been completed. So that is something that we are working on with the elected government. The team in the portfolio of the civil service is leading that. So I'm very excited about that. It's the right thing to do. Performance matters. High performance should be rewarded. It happens every day in the private sector, and we see that it works. So I think it's a natural transition for that to happen in our civil service.
DG, I apologize to follow up on you. Yes, I do agree with everything you just said, every single word.
Yes, sir.
Performance, which is hard work and doing far and beyond, rewarded. Honorarium, government sees the whole civil service doing well, it's a gift. Nothing to do with COLA.
Yeah.
Cost of living adjustments.
Yes.
So that means that regardless of your performance,
yes,
your bills are going up.
That's correct.
So whether the government chooses to do honorarium or not, has nothing to do with COLA.
Right.
Because a person may just say, you know what, I just want to be average. I want to do my job, go home to my family, and to give no extra, but I'm given what my contract obligation is. But if their light bill go up, their fuel or their rent or groceries at the supermarket go up, they need to sustain that because they can find themselves in further debt. So that's what I'm talking about, the cost of living adjustment.
Okay. Mr. Chairman, my apologies to the member. I should have mentioned that as well. So that conversation is ongoing. We, the civil service, the team in the Ministry of Finance can correct me, but we had substantial savings at the end of last year, which shows that we can manage our HR budget very carefully. But again, Mr. Chairman, I don't think that we should constantly look for savings to award COLAs. These things should be budgeted for. If it's going to cost us $20 million out of $1 billion budget to take care of your team, then we should do it. So, Deputy Leader of the Opposition, I can tell you that those conversations are ongoing. And I am certain that the person coming behind me is going to continue to fight for our civil servants to make sure that the cost of living is implemented in a timely manner.
Mr. Chairman, through you, I just want to remind the Deputy Governor of the private member motion that I already had filed. And I think, just to read for members here, this is Section 51 of the Public Service Management Act that says a chief officer may operate such performance incentive arrangements as he thinks suitable for the staff of his civil service entity, provided that arrangement comply with the personnel regulations. And 51.2 goes on to say performance incentive arrangements, including performance-related remuneration, are to be directly linked to the performance assessment system specified in Section 50. Now, that has been sitting there for quite some while and has never been activated. So, and my motion at the time, which passed unanimously, it went nowhere. We had also agreed unanimously in this Parliament for a 13% increase for for civil servants over a 3-year period. The first 5% was done, then was supposed to be another 4% and another 4%. We have not seen that, and the reason why I raised that, at the time when we look at the 13%, that was the cumulative effect of the inflation going back quite some time, and since then inflation has gone up even more. So to join my colleague from Georgetown Central in that regard, this is something that needs to be looked at. And I'm going to tell you why again now, is I have civil servants, and I'm sure you probably would have heard, where some of them had to send their helpers home because of the increase in the minimum wage, where they could no longer afford. So if you're raising the minimum wage from $6 to $8.75, parents without any requisite increase could not afford to basically keep their helpers, and after school care, child care and all of that has to be factored in right now. So there are a lot of families that are already feeling it, and for those of us who even live on fast food like me, I can tell you we all saw this, you don't get fat without eating fast food. We already have seen the impact already at some of the fast food for basic stuff. Now, the thing I want to touch on, DG, in all of that, is going back again now to the overall pension issue. And the reason why I raise it, earlier we were looking at issues relating to accounting, finances across government into some entities. Slice or dice it any way we want. Lawyers and accountants and even some other areas get paid significant amount of money in the private sector. We cannot compete with the private sector, but at a minimum what separated us was at least having a proper pension and having a proper retirement, health care and all that kind of stuff. So if we expect people in the office of the DPP or within the legal fraternity to forego where they can make 5, 6, 7 times their salary in the private sector to choose public service, there's got to be something there for it. You know what I mean? And this is the reason why I said that we need to sit down now and have this conversation with regards to the overall direction of where the government is. And the last thing I want to touch on, and you would have recalled the Auditor General's report on the long-term sustainability or the financial sustainability of the country, where they look at the impact of government growth in personnel costs over, I think, a 6-year period. But what that report didn't include, and I had touched on it already in a previous PSC, was the growth in GDP. People may not want to hear what I'm about to say, but if you look at the requisite increase in government spending and look at the requisite increase even in personnel costs that people complain about, that has literally put hundreds of millions of dollars on the local economy. We already know we have a private sector that is 60% non-Caymanian. People don't may not like when I say it, but right now the civil service is actually subsidizing the retirees from the private sector who goes and gets cynical and all that kind of stuff. So there's already a lot of strain on the local economy where they require, the majority of the, people in the civil service are Caymanians, where businesses require that money being spent, circulated in our economy by the local, by the civil service. And my friends, I want to put something in context for everybody right now. And I'm going to put a number there. And again, this may be an uncomfortable reality. In 2024, based on CIMA, the Class A banks in this country, that's the ones that we can walk into, at $986 million in revenue US and $752 million US in profit. Those banks are not Caymanian owned. Those monies do not stay here. Those money pay dividends for their foreign shareholders. The majority of the business, whether it be in CUC is still owned by Fortis, a Canadian company. The oil companies are literally owned, all foreign owned. The amount of money that leaves this country, even from the very pension investment, that does not remain in this country. So I say that to say the one entity that has reliably for keeping this economy going has been the civil servants, the Caymanians spending their money in this country. So even though it may cost something now, the wider impact of the local economy is something that is needed. That's why most businesses, as soon as government payday is there, they run their sales, they run this, they run that, because they can rely on that. And people need to understand that. So it's not just a matter of the carrying costs of the government in terms of paying civil servants money. It is also what the local economy depends on it. You know what I mean? So don't for 1 minute believe that we don't get some of this money back from local economic activity. And right now, the main spenders in this economy, which is the civil servants, the Caymanian civil servants and others that live here, do not have enough money to keep this economy going. And at some point, and we're already seeing it because businesses will raise prices when they can't get volume. And if people can't afford to spend the money, then it means business has to raise their price just to cover their costs, which again creates the very problem that we're running from. You know, so this is not something to just be taken in a vacuum. We need to look at the holistic picture. So while we can look at government costs, I also, and every MP in this House should also be looking at the local cost of the economy. And that's what I'm going to say to people. Be careful, you know, the cost of everything and the price of nothing. And you don't want to pay this price that is coming. So we need to start looking at that. So DG, I'm serving notice already. I am pushing back my defined benefit plan for all Caymanians in this country, whether public or private sector. But government need to get their act together first. And we already have seen it now, that the current system cannot work. And an error does not become a mistake until we fail to correct it. We have tried this experiment from the late 90s. It has not worked. We need to go fix it. It cannot work. And all we're doing is kicking the can down the road. And we have seen it every year in NAU, NGS 55, HEA 2, and TP 41. Every MP is aware of it now, and that's the social welfare cost of this country. So we can't have the private sector sitting down there socializing, privatizing profit and socializing losses, and the government left to turn off the light, and the Caymanian people left to turn off the light at the end of the day. This can't continue. And I have no intention of leaving this burden on my children and hopefully to be born one day grandchildren. It is unfair. It is unfair. Thank you.
Thank you. Mr. Chairman, you know, I think I just want to say amen, but I will say this. This is, Mr. Chairman, you will remember when I think 2008 financial crisis, where civil servants' salaries were rolled back by 3.2%. We gave them a a raise, and then we had to roll it back because of the downturn in the economy. I went to a corner store to buy some food about 6 months after that happened. And this shop owner said to me, Franz, when are you all going to give back the civil servant to 3.2%? I didn't think that this shop owner would be aware of this. And I said, well, hopefully as soon as possible. I think by then I had become deputy governor in 2012. And I said, well, it's one of my priorities. I would love to be able to do it. But I said, well, why are you asking? And she said, when that 3.2% was rolled back, my business has never been the same. This is a corner store right here in Georgetown. And I think that's what made me realize that what the member is saying is so true, is that the money that we pay our civil servants, the vast majority of that go back into the economy, into small businesses, and allow them to prosper. So we should never be hesitant about rewarding our civil servants for a job well done and to give them the pay that they deserve, and to do COLAs from time to time, do performance pay, because it benefits the entire community. So I am with you, sir, and I agree. Let us continue to work together to make sure that our people can retire in dignity. That's not a lot to ask for. It's not a lot to ask for. Thank you.
Mr. Chairman, I just want to, I don't have no question, but I unfortunately have to leave. I think you're wrapping up now, but I cannot miss this opportunity because I don't know. I suspect that we will be calling the DG back to another PSA meeting before his retirement.
Yeah.
But I want to say thank you, my friend.
Yes, sir.
My fellow Caymanian. You you served your duty well. You fought the war good. And I don't know who's going to step in your shoes afterwards, but they got a lot to maintain. And I'm happy, even though me and you have had a little powwow here and there throughout this political process.
Sure.
Especially when I didn't know what I know now. But I want to say thank you.
Yes, sir.
I'm proud to say that I served with you in this honorable house. And if I never get a chance to say it again, I just want to say it today. So thank you very much, Franz.
Thank you, sir. Thank you. And I feel the same way, sir. We've done some great things together. A little powwow here and there, but that's sometimes good for the soul. Yes.
Okay, I think we're done. I do have one question for you, though, sir.
Yes,
just
sir.
to wrap it all up.
Okay.
That concerns government minutes. I'm going to ask you to look into it. So I think that the Parliament is waiting for several minutes outstanding from the government. I think the last ones we had were from 2023.
Yes.
So if you wouldn't mind taking that on for us and try to bring them up to date.
Yes. Mr. Chairman, I certainly give that undertaking. If you recall, Ms. Satonya Cacho was in my office, and one of her responsibilities was working with the Auditor General, working on their reports, doing the government minutes. She's going back to education, yes. But as I said, Mr. Suku has taken on a large amount of her role, and that is something that he is now taking forward. So,
cool. Okay.
Some good news is coming, sir.
Good, good.
Mr. Chairman, through the Honourable Deputy Governor, my colleague, a member from Georgetown Central, have just shown me that on the Parliament email that just came out earlier that my bill moving the retirement age to 70 in the civil service has now been gazetted. Okay. You would remember that we had moved a motion up to 68. But just to give you a heads up, Deputy Governor, since we went and moved judges to 70, and we have this defined contribution plan, where we recognize that people can't retire now at the 65. I at least hope during the consultation period, at least get some feedback from your office. I mean, we have factored in things like succession planning and everything else, and we manage certain things. But at a minimum, what I would like to see when I raise this issue is that there needs to be a separation between civil servants once they're putting their years and retiring and getting their pension, it should have nothing to do with their salaries if they come back to work. I think they're putting their years of drawing their pension, and this thing of going back down to the lowest grade or lowest scale that I'm hearing about. If you're putting 35, 40 years and you want to save more of your golden years, they should at least be paid for what that they've been paid, and the pension is a separate issue, something to look forward to. So I look forward to whatever feedback I can get from your office in that regard, in terms of getting that done. All right, thank you.
Thank you.
Okay. Deputy Governor, thank you for being here this afternoon and giving your testimony. I appreciate the candid way in which you responded to questions and gave some interesting insights and commitments to the committee that you were doing. As always, we appreciate your candidness before the committee. And, you know, I can say just from a personal standpoint how much have I enjoyed working with you as a minister and as leader of the opposition and just now a lowly member of parliament.
Yes, sir.
But I just want to say, in case I don't have a public opportunity like this again, that I wish you well in your retirement, and I wish you a long and happy life. And I hope it won't be the last that we really see of you, because I just be honest with you, Franz. You got a heck of a lot you still left to contribute to this country.
Yes, sir.
And we got to find some way to make sure that your talents
yes, sir.
and your zeal, because I know you have been so passionate in the things that you have embraced and sought to lead forward in the civil service.
Thank you.
And it's really made a huge difference. I mean, you look at civil service from when I first became elected in 2013, where we are today. And I mean, to hear you talk about 94, positive, percent, people saying that they are proud to work for, that is incredible.
It is, sir.
I don't know if there's any other country in the world where a government could be viewed, working for a government is viewed that positive. I just don't.
Yes, sir.
And so, I take my hat off to you, sir.
Yes, sir.
And commend you. I mean, you have one heck of a legacy that you're leaving behind.
Yes, sir.
And again, I wish you all the best, sir. So,
Mr. Chairman, thank you. Thank you. Sorry.
Go ahead, sir.
Yeah, no, just thank you. It has been, sir, I have a great story to tell. I started as an intern, came in I found in dealing with my retirement, I was asked to supply my first employment contract. And I think we finally found it. I was appointed as a clerical assistant, making $5,000 a year. I thought I'd hit the jackpot when that happened. $400 a month back in 1981 was, for me, it was a lotto. But so having started there and being here today, it shows that if you have honesty and integrity, you work hard, you have a good working commitment. But it also highlights the fact I didn't get here, by myself. People believed in me, gave me opportunities to fail. They gave me opportunities to fail, and I tried my best never to fail. But I had opportunities, and that is why, as Deputy Governor and Head of the Civil Service, I have done my endeavor best to give my people the same opportunities that I have. Mr. Bryan, I share lots of memories in that regard. I introduced him to a civil servant that had just joined us. He was somebody that he was aware of. I never forget the day. And he said, DG, you gave me goosebumps, and I'm sorry, I'm never going to forget that. But it is about us trying our endeavor best to give people opportunities. That's all Caymanians really want, is an opportunity. And I am leaving knowing that I have done my best in that regard to give our people opportunities. I believe, and I was sitting in my office watching the proceedings here the last 2 days. And I was so proud, Mr. Chairman, of how the civil servants who appeared here, how they conducted themselves, their professionalism, their candor, in which they performed. But you know what? I was equally proud of every member in here because I thought it was done exceptionally well. Everyone asked the tough questions. Everyone held people's feet to the fire, but it was done with courtesy and respect. And I think that's all we can ask for as a civil service, is to be treated that way. By all means, hold us to account. This is probably the most important parliamentary committee that there is. And the job here is very serious. And supporting the work of the Auditor General is, again, so very important. So I have had a great time, Mr. Chairman, a long time. 44 years is a long time. So I am looking forward to spending more time with my family. My mom has been everything to me as a single parent. And she said to me 4 years ago now, Franz, my only desire in life is to see you retired. So I am happy, sir, that I'm going to be able to give that to her. I did say to her at the time, Mom, I'm not ready. And I need to be ready I have to feel ready. I want to give you everything you have ever asked for, but just give me some time. And she gave me that time. So I'm looking forward to this now. My conscience is clear. I feel good. I have great confidence in the team that I'm leaving behind. And I think this is, the best is yet to come. So I thank everyone here for their support. I'm proud that I'm leaving, having a Cayman Auditor General here for the very, very first time. That's a great thing. If you think about it, we have a Caymanian Commissioner of Police, Caymanian Ombudsman, a Caymanian Collector, Director of Customs, Caymanian in charge of Fire, Prison, Auditor General. Those were not the case when I first started. We had a lot of foreign nationals in those positions, not immigration or customs, but in a lot of those other positions. So I feel good, Mr. Chairman, and I thank everyone for their support. Again, like I said, none of these things that we're talking about here happen by just me doing it. I have a great team behind me. I have worked with amazing MPs and ministers who have supported a lot of the initiatives that we have put forward and worked with me to achieve some great things for our people. So we have a lot to be proud of. So thank you.
And thank you too, sir. I'll just say final statement here is that we share with you and feel your joy and happiness. Thank you so much. Members of the committee, we are at the end of this hearing, and so we shall adjourn at this time. Thank you all for being here and for your patience. I think yesterday and today, this is the first 2-day session we've ever had since I've been chair that I can remember. And I've been in this chair now for 6 years. And so we've trundled through it and got through. I think we really had a good sessions over the last 2 days and did some good work. So I thank you. We'll meet again. We'll have the administrative meeting on the 12th of February, I think it is. So until then, I wish everyone a very happy weekend. And to the guests sitting in the back there, thank you for coming and enduring us for the afternoon. But it's been a pleasure hosting you and having you to observe the proceedings here in the Public Accounts Committee. So thank you all, and thanks again to everyone.